I'm just a student.
Me, well, we couldn't
Is that enough?
Probably another one. Yeah.
First of all, I'd just like to say thank you guys for showing up, participating in our retirement seminar. Unfortunately, with the government shutdown, we don't have all the vendors that we normally have, just to that most of them were furloughed. When I reached out to them, a lot of them are not going to start working until Monday. So that's all your VA. So if you look at your agenda, you'll see at the bottom, it does have the VA benefits information. So that's a direct person you actually could call, email, and they can help you with a DSO or whoever you need to locate for your claims or answer any of your questions. Same thing with the bottom, that's for your VA health. So VA is kind of like the military, they have different groups. So you have your benefits, you have your health, and then you have cemetery. Those are the hardest ones that we could hardly ever get a hold of. But if you do call the VA, they can link you to somebody that does the VA benefit or the cemetery benefits. They can answer your questions. That's what I want to say. Be careful when you guys come down. The bathrooms are located in the hallway, halfway down. So first opening on the left, you'll see the male, female, and it has a whole gender as well. We like to keep everybody in this area. We don't want anybody walking down the halls or walking in where we work. So just everybody to stay here. I mean, obviously, if you work in the building and you have to go to your office, that's completely fine. Let's see. At the end, if you guys have any other questions, we'll stay here until I answer your questions, or I give you someone that can answer your question. Other than that, as soon as TRICARE is ready, we'll get her on here and we'll start the retirement zone. The GA 5016 is the last class. That'll be me. And then after that, I can answer any of your questions regarding the 20-year letter, RCSBP. A lot of people ask about CDRP, which is concurrent retirement disability pay, and CRCS. They're two different ones. One belongs to VA, the other one belongs to VITAS. So I'll be answering those at the end. Any one of these works from microphone?
I don't need that.
Oh, okay.
Where's that?
Good morning, everyone. All the bright-eyed details. My name is Alice Martin. I am beneficiary educator for the TRICARE program with Tri-West Healthcare Alliance. Thank you for being here today. Thank you for allowing me this opportunity to give you this information. If you have any questions, please feel free to ask. If I can't answer your question, then I will collect your information and then get back to you at a later time. Okay. There we go. Thank you.
You're welcome. I'm sorry, everybody. This is TRICARE. I was trying to get her slides up, but this is, I've worked with her for a few years. She's awesome. She has a lot of good information for you guys.
Thank you, Mr. Lopez. I appreciate you. So, next slide. This information is in regards to all of your medical entitlements. We'll go through different stages because you have different benefits at different stages of your retirement. So I'll explain that in just a minute. So the TRICARE program is available worldwide. Stateside, we have two regions. We have the East region managed by Humana Military, and we have the West region, which is managed by Tri-West Healthcare Alliance. Beginning of January 2025, the West region became bigger because the East region, though it seemed to be evenly dispersed, they were more population dense than the West region was. So that's why we have more states, but now it is more evenly dispersed with regards to beneficiary. But I like to say that the TRICARE program is the same no matter where you go. However, dependent on where you live determines which managed care contractor is going to handle your enrollments, your claims, your authorizations. That's the only difference. But otherwise, the TRICARE program is the same. Next slide. Even if you go overseas, the TRICARE program is basically the same program. However, overseas, there are 3 regions, one contractor that manages those regions. So if you go to, let's say, Europe, it is managed by the Eurasia area, and the TAO office is going to take care of everything for you there. They will take care of all your enrollment, your claims, your authorizations. So again, the TRICARE program is the same when you go to the overseas area. Just there are a few nuances different. For instance, when you have a beneficiary that's eligible, stateside, you have 90 days to get them registered in DEERS, the Defense Enrollment Eligibility Reporting System. Overseas, you have 130 days. So those are little differences like that, but basically the TRICARE program is the same. Next slide. The Defense Enrollment Eligibility Reporting System is very important to keep updated. When you are serving, it gets updated usually by the admin department. Your status gets changed by the admin department, and what you need to do is make sure that your address, your phone number, and all of that is updated in the system. Now you can go into the system, MilConnect, and update your demographics online. That's about the only thing you can update online, your address, phone number, email address. Before you retire, please make sure that you have your DS logon before you retire. Right now, they have the new system where you have to get re-verified, but it's easier to get a DS logon while you have a CAC than it is then as compared to what you would have to go through once you relinquish your CACs. So please make sure you get your DS logon. I would say about 60 days before your retirement date, because you will need to go in person to update the information in the DEER system. Yes, all of your paperwork gets submitted to DEERS, and your retirement is going to be notified to Defense Manpower Data Center, DMDC. However, you have to go in person to update the information. That's when you'll relinquish your CACs and you'll get your retiree ID card. Okay, which coincidentally is a CAC without a chip, same thing. It is then your responsibility to make sure once you retire to update the information in DEERS accordingly, whether you have an address change or you need to add a new dependent if you get married, have a baby, adopt a child. You add a dependent, it has to be done in DEERS first, or registered in DEERS first, and then you have to then enroll them into the appropriate program according to whatever your qualification or eligibility is. Any questions? Nope, next slide, please. Which group do you belong to? You belong to Group A if your initial enlistment into the military happened before January 1st of 2018. If you enlisted on or after January 1st of 2018, then you would belong to Group B. Right now, the 2 groups have the same comprehensive medical coverage. The differences are in the costs and fees. And I'll talk about that in just a moment. Next slide, please. This is a basic timeline, and I remember I said that you were going to have different eligibility for different time periods. This is a timeline, and we'll talk about specifically these timelines and what you're eligible for with regards to the TRICARE benefit. Next slide, please. When you initially retire from the reserves or National Guard, you're going to be eligible for the TRICARE Retired Reserve Program, unless you are a federal employee under the age of 60. So if you are retiring from the reserves or National Guard under the age of 60, then, and you're not a federal employee, then you would qualify to enroll in the TRICARE Retired Program. That's what it's going to cost you. I know it's ridiculous. You know what? It's actually less than what I pay when I'm a civilian. Well, even with, not now, because now I have really good insurance. But before, I was paying about $800 a month. you will follow the Group B pay periods or pays. And I'll talk a little more about that in just a moment. But when I was enrolling myself, I didn't have these benefits. But if you're looking in the healthcare.gov website, you'll see what I mean. I was paying $850 a month just for me. I had a $7,000 deductible. And then the insurance only covered 80%. So I still had 20%. And I didn't have a catastrophic cap. How many of you know about your catastrophic cap? Cool. The catastrophic cap, I'll talk about that in just a moment. But the catastrophic cap is the most you will pay out of pocket in a calendar year. Next slide, please. With the TRR program, you are following Group B, even though you may have enlisted before January 1st, 2018. While under TRR, you follow Group B, which means you follow Group B costs. So you have a deductible. With Group B, this deductible depends on whether you're seeing an in-network provider or an out-of-network provider. The TRR program does allow you the freedom of choice to be seen by any in or out-of-network provider. You do not need a referral to be seen by any in or out-of-network provider. However, it's more cost-effective to be seen by an in or an out-of-network provider. It's more cost-effective to be seen by an in-network as opposed to an out-of-network provider. But you have a choice. If you see an in-network provider, you're a single person, you're only going to pay $193. So the first $193 would be your responsibility. Next slide, please. Then once you've met your deductible, you're only responsible for a co-payment or a cost share. If you see an in-network provider, it's a co-payment. If you see an out-of-network provider, it's a cost share of the allowable bill. So if you have a visit and it's $500, but the allowable is only $75, you pay 25% of that $75. The rest gets adjusted or absorbed and you are not responsible for that. That's why it's really, 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 really important that when you get mail from TRICARE, if it's an EOB, an explanation of benefits, that you look at it, because that's going to tell you how much they were billing, how much we allowed, how much we paid, and how much you're responsible for. And if it says 0 and they're still sending you a bill, all you need to do is send them a copy of that EOB, which they would have gotten as well. But they want to find out how much you don't know, right? Most of the time when you go see a doctor, you'll get 2 bills immediately. We have up to 90 days to process a bill, but they will send it right away to you to see who pays first. And if you pay first, guess what happens once they get their money? Yeah, they will send it back to you, but it'll be like pulling teeth. So when you get a bill, if you do get a bill from any provider, regardless of what insurance you have, talk to your insurance to see if it's already been submitted and processed. If it has, and they've already gotten their EOB, ask them what you're responsible for, and you only pay them that amount, even though they're billing you $500. Okay. Next slide, please. While you're eligible for the TRR program, if you have young adult dependents under the age of 26, but over the age of 21. So our young adult dependents age out at the age of 21. Once they have aged out at the age of 21, if they are not in school full time, they can enroll in the TYA program until the age of 26. If they are in school full time, they can continue under your family plan until they turn 23 or their graduation date, whichever comes first. If they turn 23 or graduate, then they can enroll in this one until the age of 26. Little confusing, but just know that your young adult dependents are covered until the age of 26. It just depends on which program you want to enroll them into, or whether or not you want to push them to continue their education after the age of 21. Give them that swift kick, right? Next slide, please. So now you're turning 60. Happy birthday. On your birthday, your ID is going to expire. You're going to have to go back to tiers to get a new ID. That's your qualifying life event to get new coverage. So on your 60th birthday, not 65, 60, you can call or you can make an appointment, or you can just drop into the nearest pass and ID office and update DEERS, because at the age of 60, you qualified for different coverages. You are no longer eligible for the TRR program. You are now eligible to purchase TRICARE Prime or TRICARE Select. Next slide, please. TRICARE Prime is a program that is going to work very much the same as it did while you were on active duty. As a retiree now, you are eligible to enroll in the managed care option of the TRICARE program. You will be enrolled and assigned to a primary care manager. This Prime works very much the same as it did while you were on active duty orders. And you were enrolled to the Prime program, assigned to a PCM. You must seek care from that PCM for whatever ails you. And if you need to be seen by a specialist, then you need to have an authorization. The difference between this TRICARE Prime and the TRICARE Prime you were on while on active duty, next slide, please, is that now you're responsible for an enrollment cost. This is the enrollment cost. I broke it down by, or you'll see that there are two separate groups now. So if you belong to Group A, you now fall under the Group A benefits. Whether you're an individual or a family of 2 or more. A family of 2 or more can be 2, 12, or 20. After that second person, it's the same price. Okay, so if you're Group A, because I'm assuming most of you in here are Group A, unless somebody's being med boarded. Somebody being med boarded? No, everybody's Group A, right? So you're Group A, you have a family of 2 or more, it's gonna cost you $744 a year. $62 a month for a family of, let's say, 4, right? Not bad. If you're a federal employee, at the time that you turn 60, you can either suspend your FEHB benefits and only enroll in TRICARE, or depending on the program you are enrolled in, under your FEHB benefits, you can use them together. The only one you cannot use together is Kaiser and TRICARE, because they don't work together at all. Yes, sir.
Just the exact considered dual coverage when you go to the.
You have a primary and a secondary, yes. When you have dual coverage, you have your other health insurance, your FEHB, not Kaiser, is primary, and your TRICARE is secondary. Yes.
Do you have to specify base first?
No, it's always going to be OHI first, TRICARE secondary, because it's a government program. Yes, government programs usually pay last, like let's say Medicare, it'll be Medicare and then TRICARE. Or Medicaid, it'll be Medicaid and then TRICARE. Yes.
I'm just curious if there's another insurance company they work with, then they don't work with Kaiser.
The only one they currently don't work with very well is Kaiser. However, you have an emergency, the only hospital in the place, all bets are off. It's an emergency, go to Kaiser. Because there's no other hospitals in the area. Okay? So if it's an emergency, get the emergency taken care of. Don't worry about whether it's in the network or not in the network, or whether they work together or they don't work together. It's an emergency, just get the emergency taken care of. There are places that there are only Kaisers in the area. But if you have a Kaiser, a Sutter, and a North Bay, I would choose Sutter and North Bay first before I even look at Kaiser. Some people do get sent to Kaiser for a care, a treatment, or an episode of care or something. However, that's an individual special circumstance that they would be sent to Kaiser. But routinely, we don't refer anybody to Kaiser. Okay. Now, with the TRICARE Prime program, okay, little picture. Here's the picture. Let's just say that this is the military treatment facility. and you live within a 30-minute drive time from the military treatment facility, you want to enroll in Prime, and they have space availability to see retirees. So if you're living within a 30-minute drive time from the MTF, they would assign you to the MTF. You would have a PCM at the MTF. Okay. However, you do know that active duty is first to go and be seen at the MTF. So if it's just a clinic, they may refer you off base for everything other than your primary care. If you live more than 31 minutes drive time from the MTF, then you have an option to either be assigned to the MTF or to be assigned to one of the PCM designated providers within the Prime service area. The Prime service area is a 40-mile radius from the military treatment facility. So if you live within the 40-minute drive, the 40-mile radius of the MTF, but you live more than 31 minutes drive time, you could see anybody be assigned to any PCM designated civilian providers within that Prime service area. However, as a retiree, you can live out as far as 100 miles and get approval to be seen at the MTF, because what happens at the MTF? You'll be responsible for the enrollment costs, but you have no other out-of-pocket expenses. All your care at the MTF is at zero out-of-pocket. The only time you would have any out-of-pocket expenses, next slide, please, would be if you are seen by a civilian provider. Oh, keep going.
One more.
Yeah, it's wrong. Keep going. You're going backwards. Right there. So when you're being seen by a civilian provider, then you're only responsible for a copayment. As you can see, both groups currently have the same exact copayments, and these copayments do accrue towards the catastrophic cap. Go back to this, go back one, please. Okay, so this slide, I want to go back to this slide because with regards to your enrollment costs, you can pay the whole thing up front, but I don't recommend that. Or you could pay 6 months, or you could pay quarterly, or you could pay monthly. What I do recommend is the allotment program. The allotment program will deduct monthly amounts from your retirement pay to pay for that $62 a month if you have a family enrolled in Prime. I like calling it setting it and forgetting it, because once you enroll into that program, there's nothing you need to do. If there's an increase or a decrease with the fees with regards to enrollment, the DFAS or the ePay Center will take care of that for you. The only time you need to do something is if you are moving from one region to another, then you'll have to sign a new authorization allowing the new managed care contractor to take monies from your retirement pay. Okay, so you also have options of either going by enrolling into the electronic funds transfer, which deducts monthly amounts from your checking or savings, or a recurring credit card. But those things are not as sure, as safe to me as having it taken from your retirement pay, because your retirement pay is always going to count, right? And after the age of 60, you're going to get your retirement pay every month, unless, I don't know, something happens, God forbid something does, but with this world that we're living right now, a few, let's say probably back in, so I started doing this in 2009. I started at a customer service at Travis Air Force Base, and we saw, do you remember the Target security breach that happened a few years ago? Where that was during the time that we were still using checks to write for merchandise. Okay, so at that time, there was a security breach, and all of our financial institutions sent out new credit cards or new account numbers to avoid us having these problems because of that security breach. And I saw, while I was there at Travis, an influx of retirees being disenrolled for non-payment of dues because they forgot to update their credit cards with that new account number or their checking account or savings account. If you're disenrolled for non-payment of dues, you're locked out for 12 months, meaning you cannot enroll into the program even during a qualifying life event or open season. It'll be a full 12 months before you can be enrolled back into the program. You'll always be eligible to be treated at a military treatment facility under direct care, but if you are seen or sent off base, all of that cost will be on you. So please don't get disenrolled for non-payment of dues. That's why we recommend the allotment program. You don't get charged a service fee. You don't get charged anything. It gets done and processed by the managed care contractor. And it's just very simple for you. Okay, next slide, please. And one more. The point of service option is where if you are enrolled under the TRICARE Prime program, you can be seen by another doctor without an authorization or referral, but you will pay up to a $600 deductible if you have a family enrolled in the program, and then TRICARE will only pay 50% of the allowable. You will be responsible for the other 50%, and all the monies that you're paying for being seen or exercising the POS option is not going to accrue towards that catastrophic cap. So if it's non-emergency, it doesn't count. But if it's for, if it's non-emergency, it counts. If it's an emergency, you don't have to worry about it. So if it's an emergency, there's no other option. You don't know where they're in it. Just take care of the emergency. But if it's a non-emergency, let's say you went skiing, you hurt yourself, and you went and saw a doctor, and that doctor who treated you for that emergency said you needed to go see an orthopedic surgeon to get your cast set, but you didn't go back to your PCM to get a referral. So that orthopedic surgeon, because at that time it wasn't an emergency, right? You've already seen an emergency or a doctor for that emergency. That care would need to be approved by the TRICARE program in order for you to get that care. Otherwise, you'll have to pay that point of service option. Next slide. TRICARE Select is the option that allows you the freedom of choice to be seen by any in or out of network provider. You can see any doctor at any time without an authorization or referral. If you do have a service, you may have to have that a service pre-approved. So the example I like to say use is if you need rhinoplasty because you need to breathe, that's going to be covered by TRICARE. But if you're going to need rhinoplasty because you want to look like a movie star, that's going to be totally out of your pocket. Okay. Now, with the TRICARE Select program, you do not need to be assigned to a doctor. However, I do recommend that you have a general practitioner or a family practitioner in your back pocket or somebody you see for all of these things that ail you so that they can assist you with regards to any specialty care that you might need in the future. So let's say you develop something, you went and saw your general practitioner and says, you know, I don't know what this is on my skin. Do you think I need to see a dermatologist? Yeah, you need to see a dermatologist. Okay, I'm going to go see a dermatologist. But then that dermatologist says, or you don't know which dermatologist to be seen, that general practitioner can refer you to a dermatologist within the network. So they can help you in that sense. But you don't need an authorization to go and see that dermatologist. Now, if that dermatologist needs to be doing a surgery or a service outside of a regular office visit, that's when you would require an authorization or a referral. Next slide, please. The cost for the Select program is as indicated on here, depending again which group or how many you have in the family will determine what your out-of-pocket expenses are going to be. Yes, the enrollment cost for the TRICARE Select program is less. Next slide, please. However, you do have a deductible. And as a group A'er, you have a $150 deductible, whether you see network or non-network, or if you have a family of 2 or more, it's $300, whether it's network or non-network. Now, once you have met that deductible, next slide, please, you will have a copayment because all of your care under Select is usually at a civilian provider's office. However, if you are enrolled in the Select program, you can be seen at a military treatment facility. They have to have space availability. So if you're in my neck of the woods and you go to Travis, we have space availability very minimal. Okay. We do have an emergency room that you can be seen at any time for an emergency. 0 out of pocket. If you go to an area that has a military treatment facility and they don't have space available, then you would have to be seen at a civilian provider's office. And that's where these costs are going to take place. So again, it's more cost effective to be seen by an in-network provider. And you can ask them, are you an in-network provider or an out-of-network provider? They will tell you. They have to tell you. Okay. All of these costs accrue towards a catastrophic cap. Your enrollment costs, your co-payments, your deductibles, and your cost shares. Next slide, please. This is your catastrophic cap. Dependent on whether you are enrolled in the select program or the prime program will determine which catastrophic cap is. So the catastrophic cap is the most that you will pay out of pocket in a calendar year. Let's just say, God forbid, you are in a car accident and you are hospitalized for a week. You get a bill 2 months later for over $250,000 because that's how much it costs to be hospitalized nowadays. The most you'll be responsible for if you're enrolled in the TRICARE Prime program is $3,000. After that, the TRICARE program is at 100%. Remember I said earlier not to pay the whole year upfront for TRICARE Prime or TRICARE Select? The reason I don't recommend you paying the whole year upfront is if you meet your catastrophic cap, you're not going to have to pay enrollment costs for the rest of the year. So if you are at 6 months and you've met your catastrophic cap, the rest of the 6 months are at zero out of pocket, including enrollment costs. Make sense? So you can pay 6 months, you can pay quarterly, or you can pay monthly. Makes it easier, right?
If
So
you're on automatic deduction, does that automatically kick?
I don't like using that word automatically because then it gives you a
Oh.
false sense of security.
No,
But yes,
I
it
saw that
does.
read it up, and I'm going along. I hit a catastrophic cap because DFAS with TRICARE stop the deduction.
Yes,
Automatic.
they should, but it would be up to you to check and make sure that they do. So yes, if you go on to millconnect.osd, you can see what your running total is for your deductibles and your catastrophic cap. And once you reach your catastrophic cap, they will stop deducting monies from your retirement pay, and they will stop deducting money if you decide to do the electronic funds transfer. They won't bill you anymore. That's why I say it's really important to make sure that you understand what your EOBs are, because when you start getting those EOBs and it says zero, and your provider is sending you those bills that are saying $500, you just send them a copy of your EOB and say, I owe nothing. Very simple. Any questions? Others? Next slide, please. TRICARE and other health insurance. So I indicated that Kaiser is not someone that plays together with the TRICARE program. You can have Kaiser, and a lot of beneficiaries, retirement beneficiaries, do have Kaiser. Use your Kaiser in the civilian and use your TRICARE with military. So you can use your TRICARE all day, every day at the military treatment facility. Let's say you're enrolled in Prime. Be seen at the MTF, but if the MTF sends you off base to be seen by a civilian provider, even if they give you an authorization because they're assuming that you only have TRICARE Prime and they have to give you an authorization to be seen by that civilian provider. So if you go off base to be seen by that civilian provider, but you have Kaiser, you're going to be responsible for the total cost of that bill because Kaiser is not going to pay for it. And in the civilian sector, Kaiser pays first, TRICARE pays second, but TRICARE will not pay if you have Kaiser. Okay. If you do have any other health insurance, Blue Cross, Blue Shield, HealthNet, Humana, Cigna, Pacificare, Aetna, any of those other commercial policies can be used together with the TRICARE program. You can have TRICARE Prime or TRICARE Select, it doesn't matter. But if you are, let's say you have TRICARE Prime and you're being seen at the MTF, but then you want to be seen by Dr. Smith off base, who is in the network of your Blue Cross program, then you can just go see Dr. Smith without having to get approval from the TRICARE program. Because in the civilian sector, your OHI or other health insurance rules. Your other health insurance will bill and pay whatever they're going to pay. But let's just say, for instance, you are like me, you have other health insurance and you have a deductible of $7,000. But with TRICARE Prime, is there a deductible? No. You have a copayment, $25 for a general practitioner, So what are you gonna have to pay? $7,000 with Blue Cross or 25 with TRICARE? 25 with TRICARE, because it'll get paid. And for the insurance, the other health insurance, it doesn't matter how or what gets paid. What happens is it gets absorbed or adjusted off. Okay. Next slide, please. TRICARE for Life is the program that you're going to be eligible for upon your 65th birthday. So this is another milestone that you're going to have to go and visit Deers for. But first, about 90 days before your 65th birthday month, you're going to start getting a lot of information from the Social Security Administration, letting you know what you're eligible for with regards to Medicare. TRICARE is the Medicare wraparound coverage, but you first have to get your Medicare in order for TRICARE to, in order for you to be eligible for TRICARE. So Medicare is going to tell you that you're going to qualify for Medicare Part A, which is hospitalization coverage. There is usually no cost for that coverage. Medicare Part B is for outpatient visits. Medicare Part B is going to cover or pay for your doctor's visits or any of those office visits that you have to the doctor's office. You must have Part A and Part B in order to be eligible for TRICARE for Life. Once you have purchased Part B, then you will be eligible for the TRICARE for Life plan. Once you get your Medicare card, your little red, white, and blue card, you'll go to the Pass an ID office, update the system, and you'll be eligible for that TRICARE for Life plan. There is no enrollment cost for the TRICARE for Life plan. The only enrollment cost you're paying is for Medicare Part B. Yes.
Sorry, you said you have to do up to enroll in TRICARE for Life?
No, because they just flipped that switch, which indicates that you are TRICARE for Life. There's no enrollment that you have to do other than Medicare Part A and Medicare Part B. If you are eligible for Medicare and you decide to decline Medicare Part B because you just don't want Medicare Part B, it's going to be more expensive. And if you decline Medicare Part B when you are eligible for Medicare, you're going to be penalized by the Social Security Administration for the rest of your life. So please make sure. The only exception to the Medicare Part B is if you are working and you have, let's say you're a federal employee and you have other health insurance. So you have FEHB and you didn't suspend it, you still have FEHB, but you also have TRICARE, then you can continue not having that Medicare Part B until you retire from that federal job. Does that make sense? Yes. Yes, you can. It follows the person who turns 65 first. So it doesn't matter. It doesn't matter if it's the sponsor or the spouse. It just follows the person who turns 65 first.
If the sponsor dies at 66 and the spouse is 59, the stay on TRICARE for Life.
No, if the spouse is not yet qualified for TFL, then the spouse will qualify when that spouse turns 65. Yes. You'll be able to collect Social Security, but not Medicare, because Medicare is age related.
They go back, they would be qualified for TRICARE for TRICARE Prime.
Prime until they turn 65 and then they qualify for TFL. Yes. It follows the person. Also, you could use any combination. I didn't say this before. Under TRICARE Prime or TRICARE Select, you could use any combination. You don't have to have one person, everybody in the family enrolled under Prime or everybody in the family enrolled under Select. You can have the spouse enrolled under Prime and you can have the sponsor enrolled under Select. It doesn't matter.
Individual cost of the family.
You're going to pay the individual cost for one and the individual cost for the other. You're still paying almost a family, but it's going to be different because you're under Prime because you like the structure, and ma'am, you will be under Select because you like the freedom, but you're paying the $160 for
individual cost.
Yep. but you have one catastrophic cap for the family. Yes,
If the sponsor passes, then the beneficiaries lose their ability to retain TRICARE if they get remarried.
yes. I say they have to live in sin with that new person. Nothing happens automatically. Once the sponsor passes, they'll have to visit Deers and show a death certificate so that Deers can update that the sponsor has now passed. The spouse will retain coverage as long as the spouse is unmarried, unremarried, not unmarried, but unremarried. So you just have to live in sin for the rest of your life. It'll be it'll be a common law marriage after that 7th year. Another question? No?
I do have a question.
Yes.
So if I decide not to sign up for TRICARE after I retire and I can wait till age 60?
Yes.
Okay.
Yes. You can decide not to sign up for TRICARE until you turn 60, which is your next qualifying life event. Qualifying life events allow you that 90 days. So you have your 60th birthday and 90 days after. With other health insurance like civilian coverages, your birth date is only a qualifying life event for TRICARE. It is not a qualifying life event for any other health insurances. Some people think, oh, well, I'm going to turn 60, I'm going to enroll into something. No, you can only do that with TRICARE. With TRICARE for Life, again, you don't pay anything to enroll into the program. Medicare pays 80% of the medical costs. TRICARE pays that 20% that's left over. There are no out-of-pocket expenses unless you have a service that is covered by one and not the other. For instance, chiropractic care is covered benefit by Medicare, but it is not a covered benefit by TRICARE. So if you had chiropractic care, Medicare would pay 80%, you would be responsible for that 20% that's left over. And the same goes for if you had a service that is covered by TRICARE but not covered by Medicare, then TRICARE would pay 80%, Medicare wouldn't pay any, you would be responsible for that 20% that's left over. Yes.
This whole basis is specific to the in-their terms, or is this like the same program if you retire AGR?
No, if you retired AGR, it's different. Yeah. With AGR, because you're retiring as an active duty, whatever age you can collect TRICARE, or you can purchase TRICARE Prime or TRICARE Select.
Mark. So if you guys are AGR, when you're listening to TRICARE here, it's not for you. So when you have your AGR retirement seminar and they have TRICARE there, they'll explain it because yours is way different than a traditional MD.
Yep.
Right?
Who's AGR here? Okay. Like your ears. Well, except for this.
But all the same rules apply at age 60 and above.
Yes, after the age of 60, all the rules
Everything
apply.
comes into.
Yeah, everything
at
comes
age
into
65, everything turns into Medicare Part B.
Correct.
Yeah.
Correct. So you're okay now. We've passed that hump.
Just pay it different than.
Yeah, it's just when you're in that gray area period, under the age of 60. Yes.
So is a reduced age retirement, is that gray area or not?
That is great area. So after she was gonna be done speaking, I was gonna tell everybody that has deployments in your traditional grant, you get that early age drop. TRICARE does not kick in until you're 60. And when you come through your appointment, we'll explain that to you too with your benefits when it comes to TRICARE. That's one of the first questions they asked. Oh, do I qualify for TRICARE? Absolutely not. You don't until you're 60.
Well,
So
you
you're
qualify for TRR.
Yes, and you qualify for TR, but you're not qualifying for what an AGR would get when they retire.
Yes.
They're paying that lower rate. I pay $62 for my family.
Yep.
So you guys would just have to wait until you turn 60.
Thank you. Medicare also offers Part C it's the Medicare Advantage plan. You don't need to purchase that. And Medicare Part D for drugs or medication, you do not need to purchase that. So the only one you need is Medicare Part A, which is given, and Medicare Part B. That's it, okay? Once you get your little red, white, and blue card, then you go to the Pass an ID office, get your new updated ID card, because you will notice that your ID will expire on your 65th birthday as well. So that's your next milestone to go to the Pass an ID. Next slide, please. The pharmacy option or pharmacy coverage comes with any of the TRICARE plans that you are enrolled into. So there is no additional fees that you pay to enroll into the program. If you are near a military treatment facility, you can continue to pick up your medications at the MTF, regardless of whether you're enrolled in the TRR program, the TRS, the TRICARE Prime, TRICARE Select, TRICARE Young Adult. It doesn't matter which program in TRICARE you are enrolled into. You can still pick up your medications at a military treatment facility. Even if you're not assigned to that MTF, you can pick up your medications there. The caveat is that they have to have that prescription available there. Some military treatment facilities don't necessarily carry all of the prescriptions that are necessary. It just depends on the population of where that MTF is at. So if they have it there, you can pick it up to a 90-day supply. If your doctor wrote a 90-day supply at zero out of pocket, you and your dependents. It's not just you, it's for your dependents as well. If the medication is not available there, then you can pick it up at a retail network pharmacy. However, that is only a 30-day supply that you can pick up at a retail network pharmacy. If you are on a maintenance medication, something you take on a daily basis, Motrin, high blood pressure medication, cholesterol medication, birth control pills, that you can enroll in the home delivery program, which is a great option. It delivers a 90-day supply every 75 to 85 days once you are enrolled in the auto refill program, and there's nothing you need to do. You will need to have a credit card on file so they can charge you the fees according to whatever the prescription is, whether generic, brand, or non-formulary. But it's very simple. They will send it to you without you having to do anything further. Now, at the end of the 12 months, they will contact you, ask you if you're continuing to take that medication. If you say yes, they will reach out to the provider, get a prescription refill from the provider. So everything is done on the back end. You don't have to do anything. Just make sure that credit card is available to be charged if that prescription is going to be approved by your provider. And it will continue through the next season. Okay. I think it's a great option for those of us who do. I used to be on a prescription program and it was so convenient. I didn't have to run to the pharmacy, deal with parking or people at the pharmacy in line, I mean. Because that could be a feat sometimes at Walgreens. So it was really convenient. And they don't they don't charge you a convenience fee. They do charge you the fee for the prescription. But other than that, it's really convenient for those of us who are really busy in our lives. Next slide, please. The Federal Employees Dental and Vision Insurance Program now offers 13 different companies to cover your dental care. They offer 13 companies, 2 plans each. They, with this company, I am very careful because words don't sound the same. And the reason I say that is because, God bless you. If you are retired, that is a qualifying life event. So you're retiring, you're going from active duty or active reserve to retiree status, right? That's a retirement, it's a qualifying life event. With them, you have to be losing active duty coverage and gaining retiree benefit to show that you are a qualifying, that it is a qualifying life event. Does that make sense? So when you retire and you want to enroll into the FedVid program, you can't tell them that I'm retiring because it's not a qualifying life event. But if you tell them I'm losing my active reserve benefits and gaining retiree benefits, that's a qualifying life event. So why do I have to say so much? Can I just say I'm retiring, please? I already talk enough. Anyways, so go to benefits.gov, enter your demographics, how many you have in the family, where you live, and they will give you a listing of all of the different programs available in your area. You'll get a list of all of the different programs with their premium information, how much they cover, what their limits are. When you're doing that, compare apples to apples, meaning compare premium to premium, coverage amounts to coverage amounts, and policy limits to policy limits. Where one company is going to charge you $90 for a premium for your family, they will only cover 50% of a crown. Where another one will charge you $98 for a premium, they will cover 80% of a crown. I would prefer to spend those few extra dollars per month to have them cover 80% of a crown than saving that money per month and then having to dish out that much money should I need a crown. 50% of a crown could be quite expensive. Also, some companies will offer $1,200 policy limits, $1,300 policy limits, $1,500 policy limits. That means that's the amount of work that you can have done. But the good thing about this FedVIP is that they have their open season at the same time that TRICARE does, which coincidentally starts the day after tomorrow. Open season is the time period of the year that you are able to change the program that you are currently enrolled into. So open season happens every single year between the second full Monday of November to the second full Monday of December. During open season, if you're happy with the program that you're currently enrolled in, there's nothing you need to do. You go on your merry way. But if you're unhappy with the program that you're enrolled in and you want to change, or let's say you're under select and you are now living in an area that you think you might want to do prime and you don't have a qualifying life event, open season is that opportunity for you to change. So with an open season, during that November, December date, you can enroll into a new program, but the effective date of that new program won't be until January 1st of the following year. Whereas a qualifying life event, when you have a change in your life that allows you to change, that can happen anytime during the year. And a qualifying life event allows you those 90 days to enroll into the program. Let's say, for instance, you're retiring 1 November. You can enroll anytime between November, December, and January. And the effective date of that program will be 1 November. Make sense? So that's with the qualifying life event, but with an open season, you enroll in November, December, and have your effective date 1 January that following year. And again, it happens, the FedVIP program does follow the TRICARE. And what the good thing about that is that, let's say, for instance, you have come to the end, almost the end of the year, and you find that you're going to need some more dental work. Because they have a high and a low plan that they offer, you can change that new dental program to a high for next year, then have that dental work and have more coverage than you had when you were under the low plan. You have options. Next slide, please. They also offer vision coverage. Now, TRICARE will cover your vision exam as a preventative visit. That is at zero out of pocket, regardless of if you see an in-network provider, an out-of-network provider. No, not an out-of-network provider, only an in-network provider. But whether you see, excuse me, a doctor on base or a doctor off base. So if it's preventative, you can have it done at zero out of pocket, even if you see a civilian provider. But if it turns out that you need glasses as a result of that preventative vision exam, the glasses and contacts are not a covered benefit through the TRICARE program. Through the FedVIP program, enrolling in the vision options will allow you coverage for your exam, your glasses, contacts, LASIK, and PRK surgeries if that's something that's warranted for you. They have 5 different companies that offer you also 2 plans each, and you also may change during the open season depending on what your needs are. It's very cost effective. This program in this area and Fairfield, Vacaville, so all of Solano and YOLO Cap. Yolo County, excuse me, it's starting to get to the end of my presentation. I can tell now. Excuse me. It's less than $20 for one person to be enrolled in this program. It's really a good program. Again, go to benefits.gov and you can find your information as to which program is best for you. Again, comparing apples to apples is going to be your best bet to making a best decision as to what is more effective for your family. Next slide, please.
That question.
Oh, yes.
When you say compare apples to apples, what are the three things you mentioned? You said premium, policy.
Premium, policy amounts, and coverage limits. Mhm. All of the programs that I have discussed in this brief meet the minimal essential coverage requirement of the Affordable Care Act. At the end of the term, which is January, well, it's December, but in January, December, you will receive your Form 1095. We'd like to recommend that you keep this form with your taxes in case you are audited. This is the form that you would need to use to show proof that you were enrolled in the TRICARE program. Right now, the government is not really doing much with penalizing anybody if you are without coverage, but it's best to have and not need than need and not have. My motto. Next slide, please. Take a picture of this, but I also have information at my table that you can come by and pick up if you do have any questions regarding the contact. But it's always good to have this information on your phone because that handy dandy phone, oh, you know what? I don't even have mine with me. Thank God. But I have my phone. Any questions? Yes.
Is Travis in there something?
No, you have McClellan, which is a satellite clinic of Travis, David Grant Medical Center. So if you live here in the Sacramento area, however, right now they're not accepting retirees. They're only accepting active duty and their dependents on Prime, and not even children, just adult dependents. Yes. And then you have Beal. Beal is a good hour and 15 minutes maybe from here, but they're a clinic. Your best bet would be Travis Air Force Base. 1 second. Yes.
During open enrollment, can you move between the prime and select?
Yes.
If you want to make a change?
Yes. Yes. You certainly can. Yes.
I was gonna say, I think, Holland is accepting urgent care now
No.
for retired.
No. VA is, because McClellan is at a VA building and they may have urgent care, but not for prime beneficiaries or TRICARE beneficiaries. But if you're a veteran, you may be able to have your urgent care there. Any other questions? Yes.
Is there a grace period for life events to enroll?
So it's that 90 days after that qualifying life event. I'm sorry?
I probably missed that part. James said it.
But yeah, if you have a qualifying life event, you have 90 days from that qualifying life event to enroll into a program. However, you first need to make sure that your DEERS is showing effective, and then you can enroll into that program. DEERS may sometimes take between 24 to 78 hours to update the system. So let's say you update it on Friday. It will not show updated until Monday, well into the morning. So if your day 90 is Friday and you expect to enroll on Friday, it's not going to happen. You're not going to be able to enroll on Monday because you've lost that window.
This is from the time of the published return order, right?
Mm-hmm. Yeah, so if your effective date is 1 November, my recommendation is call them. If you know what your retirement date is, call them and make an appointment for that first day of your retirement. You can do that. I wouldn't say just drop in, because sometimes dropping in and they're too busy, they can't see you, then you're not gonna be able to do what you need to do. So I would say just call and make an appointment for that first day of your retirement. Yes.
And you said something about how to sign up. You guys want to get into your cat card for a lot.
A DS logon. DS, it's a direct service logon. Yes, it's for the Mill Connect website. So once you relinquish your CACs, you will not have access to the Mill Connect website without a DS logon. And now they make you re-verify yourself. So while you have your CACs, you're verified, right? You can insert your CAC into your computer, go onto the Mill Connect website and enter that way. However, once you retire, you're not going to have your CAC. So you have to have a DS logon, which allows a password, a logon in username and password. Now, the username and password is going to expire every 90 days. I would encourage you to use a passphrase. I like my mom's cooking. Easy, something easy. Have an upper, a lower, a number, and a special. Whatever you want it to be, but something easy for you. Don't make it password. A lot of people do. It doesn't? Oh, well, good for them. Don't use your name and date of birth. Don't use a passphrase, because it's really difficult. I found in working in this, it's very difficult to figure out a 13-character word. There aren't very many 13-character words, but you could use a passphrase, and the spaces count as a space, count as a character. So make it a passphrase. Again, I like my mom's cooking. I love my mom's cooking, but that's not my password. But that's what someone said to me. Yeah, what do you love? Just put it in there. And it makes it a little bit easier, because every 90 days having to change it, oh my goodness. Oh, also, leave your computer on for 24 hours once you change it. Because if you don't, then it'll mess up. Yes, sir.
It's really important for everybody to have a DS logon now, because my auth is replacing DS logon.
Yes, that's what it's called.
So some government sites are still taking DS logon, and other ones are making you sign up for my auth right now. So, yeah.
It's my off. We call it Okta on one side. Yes, sir.
But also, VHC, they're getting rid of DS login, you have to be logged in as well.
Yeah.
That's a thing.
Now that he just said it's happening too.
I know that my off, I just did my off. Because I couldn't log on like Thursday.
And it'll probably change in another week and another week.
Seguro.
Yeah, so some sites are some mill sites, and I can't keep up with it, but DS Logon is no longer, and now they have logon.gov, and they have Verify Me, and they have.
Yeah, it's Verify Me.
Right, in
Verify.
conjunction, well, the Verify Me is one thing, it interrelates with the other protocols for these other stuff. So I would just say that it's gonna probably change again and change again and change
Yes.
again, and we just gotta play with it. But
Yeah.
so the other one too, for those that AGRs are not in here, but it's not in this brief, but when you lose your ID card, you lose your TSA benefits too. Okay, so you gotta go. You want to go and get that done if you want to keep your TSA airline benefits,
Oh, yeah.
and you
And
gotta do
that's
that before you lose your, mill card and all that.
really important.
Once you go on the other one, you lose all that.
And during this shutdown, if you didn't have your TSA pre-check, you were hurting. I was traveling and it was bad. However, if you can afford Clear, Clear is really good. But if you're a member of United Miles, you get a discount.
Or Amex.
Or MX, yes. So it helps, let me tell you. Sacramento Airport had an hour delay of line after people, and I just walked my happy butt to the Clear TSA pre-check and got right through the line. You don't have to take off your shoes. You don't have to take off your computer. You don't have to take out any of your liquids. You got to make sure you are within compliance, right? But, oh, and I have to take off my watch. But anyways, I mean, those are little tidbits, and it always helps to get some of that information. Any other questions? Yes.
If you have not, let's say, you retire early, you fall off the TRICARE map altogether, you turn 60, is there any documentation that you'll need to come back into it? Or are you already in the system?
Other than having to update DEERS, you have to update DEERS first,
Right.
but you don't need any other documentation.
So it's gonna end up happening. You do that. And you do get your retirement. You're gonna get another order. So you guys understand, when you guys retire, not really retired, you're going into the gray area of retirement. That means you have to wait to collect your retirement pay. So once you come to see us and you're gonna get your pay and we're done with everything, it goes to HRC, goes to DFAST, you're gonna get another order, an actual retirement order. You're no longer gonna be in the gray area of retirement. They're gonna actually retire you. Like my wife, she just retired. She's National Guard M-Day. She's like, oh my God, I'm retired. I said, no, you're not. You're actually in the gray area of retirement. Your benefits are different. You don't get the same benefits as a retiree on active duty. They get TRICARE, they get everything all up front. You just have to wait for that period until you reach 60. Because active duty member, when they get their ID card, their next time to change is when they turn 65, because that's TRICARE for life. For M days, you're going to get your retiree card. Then you're going to get another one, because at 60, you're going to get another one at 65 to place you into TRICARE for life. So to answer some of those.
Yes, so with you, it's 60 and then 65. And then the 65 one is going to be indefinite. But you'll see that in your ID cards, it'll have an expiration date. And some people don't. That's what happens.
Just to recap, you said 90 days when you reach it, so you have to.
Whenever you have a qualifying life event, whenever you have a change in your life that allows you to change the opportunity to change the program, then it's a qualifying life event. You get married, you get divorced, you have a baby, you move from one job to another, you moved from one house to another. That's a qualifying life event. So a change in your life that happens that allows you the opportunity to change into TRICARE Prime, TRICARE Select, or you turn 60, that's your qualifying life event, only with TRICARE though. When you turn 60, then you have 90 days from your 60th birthday to change to the TRICARE program. Yes.
So I understand that if you're traveling, but you live on the West Coast, you'd be in TRICARE West, right? But if you like move to a state within the Eastern region under Humana, do you have to switch?
Mm-hmm. If you're living in one area, in one region more than 30 days, so let's say you live in the West and you're going to visit the East, if it's not more than 30 days, you don't need to do anything. But if you're moving to the East and you're going to be there for more than 30 days, then you need to change.
Even if it's just traveling?
If you're traveling, no. If you're traveling and you're not going to be in one place for more than 30 days, you don't need to change. If you're on Prime, you do need to contact your PCM in the previous region. But if you're just visiting and it's not more than 30 days, there's nothing you need to do other than just contact, depending on the program that you're enrolled into. Also, when you are TRICARE for life, Medicare does not work overseas, but you have to have Medicare stateside in order to be eligible for coverage overseas. So if you have Medicare here, then you have TRICARE for life. You have to maintain that in order to have TRICARE coverage in the overseas area. We do have some beneficiaries who live here 6 months and live back there 6 months, and they think, oh, well, I'm going to be back there 6 months and I don't need my Medicare. Well, you do. Because if you want medical coverage, you're not going to be able to go to a military treatment facility because they don't have space availability there, especially as readily available as we have it here. So you have to maintain your Medicare here in order to be able to use your TRICARE there. If you're living in the East region area, northern part, that area has another program called the US Family Health Plan. That program there uses facilities like the Mayo Clinic or John Hopkins facilities. That program is like the TRICARE Prime program. However, they don't use military treatment facilities because those facilities there is geared more towards the active duty service member as opposed to having retirees or dependents being seen at those clinics. So if it's like a small clinic, they only will see an active duty service member. They will not see a family member or a retiree or their family members. Thank you very much. And congratulations to all of you.
All right, guys, so we're gonna go ahead and take a 15-minute break. Unfortunately, family programs, they had an emergency, so they won't be here. That's why we're gonna let you guys go on break to 9:30, and then we'll have Cal Vets will be the next week. And then you'll be in the and TRICARE will be here until 11. They have a table out.
Yep.
In their atrium. I have an issue but you actually.
Oh, thank you.
Yeah, it's, I mean, I've been a little frustrated before. That was an issue. Yeah, so.
There he is, Sir Samantha. How are you, my friend? Yeah.
No, those.
Okay. This contract is only 3 of us.
Yeah, so now.
Well, the work down south is clear.
I haven't been there.
Okay.
Let that water.
No, we have water, but they,
We're all.
Yeah, so the ones were.
feels, yeah, they,
Yeah, that was.
got that, you know.
Yes. Oh, my God. No.
2.5 feet, 3 feet deep, because they weren't able to. So I'm waiting for them to stop it.
Yeah.
And even, yeah, well, they had harvested all that rain, and so they barely got it out of there. And to be frank, I may write it off, because I don't want my dogs getting hurt.
Yeah.
Where's your point?
Right out at the airport.
Okay.
Yeah, and it's kind of, they don't run it very well. We always get water late.
Yeah, you guys don't flood up till like December.
Yeah.
Incapacitated
And they keep
minor
up with
or
it.
the
So,
incapacitated minor.
It's just,
in
they charge you
years,
for,
so that you can continue under your
security
TRICARE
patrol,
benefits.
but the
Sorry.
security patrol,
Yes.
that is this old veteran.
You have
You have one of those, you have one of those Connex, you have one of the, are you on the west side or east side?
West side. Night.
West side.
Thank you, bro.
Yes.
Yeah.
Once he's
So you guys all
insured,
have those
it's showing
Connex
other
and everything
people
out there.
employed.
No, they won't let us have fun with that.
That's the other
in
guy, that's the
TRICARE.
other side.
Yeah, we would love to have Connex.
Yeah, last year you guys, last
In
year,
the valley.
I remember driving up many times. Somebody had put all their snow goose decoys, but they had a really crappy field. They got like totally toasted. And I'm going, oh, man, I don't like that guy.
Yeah.
Now, so what I'm probably going to do is, we still have our dry fields and they were taken care of. So I'm just kind of waiting for the geese to get in.
Yeah.
They're not here yet. And I'll probably turn all my efforts to just doing that.
Yes.
If
Yes.
if they stomp it, it's bad, but the dogs don't get it. You know, it's hard on the dog,
Yes.
but it's not gonna, tear a tendon or whatever.
Yeah.
But
Correct.
here, I should be sure.
Yeah,
I mean, these are the worst I've ever seen.
You want to see a picture of a really bad field?
15 years. Oh, it's horrible. I mean,
Well,
It's funny. You still playing soccer games.
oh, yeah.
My wife is like, when we start talking about like, honey, in August.
Because remember during the.
Okay, I'll talk to you, February.
February, yeah. February 21st or whatever it is.
Yeah.
It broke,
Oh, yeah,
Once
that's
you turn
not.
60, they get
it
it.
broke the, like, we had.
yeah, broke my ATV. I was out there.
We put the
Yeah, I
truck
was
on
out
the
there.
ATV.
Yeah, so if they don't, again, I'm just waiting. He's gonna stop. He stopped some of it.
Busted.
And I don't know if the stopping is gonna take all that out. They say it will greatly close.
I'm already.
I've
if without the government shutdown, this retirement seminar, you guys would have 14 speakers. So it's not like AGR, theirs is spread out. They get 3 days. You guys get 1 day. So I know it's a lot of information. That's why we encourage all of you guys, especially if you have 18 or more, to keep coming to these because you're only going to remember, I guarantee you, you're going to leave here and a week and a half, 2 weeks from now, I'm going to get a call from somebody. Hey, you know, and we'll help you out.
So what's the next one?
Next one's in February. And that's going to be, I believe that one's in
Los Alamitos.
Los Alamitos. The reason why we like to spread them out, so before we were only doing 2, we're doing north and south. Because after COVID, we started doing retirement seminars all over again. That's when I got hired. But with that, we were only doing north and south. Obviously with funding, when it comes to ITA funding for the spouses, it's hard to get it. So now what we did is we're gonna do 4 retirement seminars throughout the year. So you're gonna have 1 north, south, central, and central coast. So Fresno, SLO, Los Alamitos, and here. With doing that, it does make it easier. So if you do live in Fresno, you can go to the one in Fresno. So now we're not have to get as much funding for the ITAs. Because I know even though you're living in Fresno, if you're outside the 50 miles, spouses are authorized, the ITA, invitational travel funds. So, but other than that, if you guys get this number down for family programs, she said this was the slide she wanted up for you guys. If you guys are all good, we'll start with Cal Vet briefer, Ms. Campbell.
That's it? That's all I get? That's what I get for coming in on a Saturday, huh? Good thing I didn't come in on a holiday. So my name is Sean Campbell, and I guess if I could start off with a little bit of a story, right? Because everyone loves a good story. I was that kid who joined the Navy at 18 because I couldn't wait to get out of my parents' house. And as soon as I could run out the door, I ran away, joined the Navy. And you know, the Navy, they're notorious for sending you as far away as possible. So being a kid, originally I'm from Philadelphia, but I moved to Sacramento. So being in the Navy, they sent me as far away from Sacramento as they could. They sent me to the Naval Hospital in Oakland. I really didn't get that far away, but then, you know, I did a couple of years, and that was before the internet, so that's when the doctors were like, hey, did you see that? Okay, now it's your turn to do it. I was 18 and doing all kinds of stuff. It was really crazy in the Naval Hospital. And then after doing that for 2 years, they said, hey, you're from California, you did your 2 years of shore duty, it's time for your 2 years of sea duty. And I said, sea duty? Well, wait a minute, I've been in the Naval Hospital in Oakland the whole time. Isn't this enough, like, warfare? Living in Oakland? They're like, oh, time for you to go see the real world. So they said, well, you're from California, so we're gonna send you to the greatest place in California. I said, California? They're like, yeah. You like Palm Springs, you know, rich people golf. I'm like, Palm Springs, yeah, that sounds good. Yeah, there's a place called Puerto Thomas. You out there, you gotta go to this little school first. It's kind of like boot camp part 2. You'll learn how to work with all the Marines. And so after spending nearly 4 years with the Fleet Marine Force, traveling around the world, seeing all those great, exciting places like Qatar and Somalia and a lot of desert countries, it was a great opportunity for me to finish college. And then I worked as a security guard for like 25 years. And I started off with this guy with a flashlight and went into being in charge of a crazy patrol team with like 300 people over several counties. Now I work with the state of California, and all the different departments they can send me to, they send me to the Department of Veteran Affairs. The reason that the story is so important is because it just gives me a great opportunity to not only pay back all the camaraderie and all the fun times I had while I was in the military, but it gives me a really good perspective and ability to travel around the state and answer questions. So this right here is our Veterans Resource Book. And this, right now they're working on the 9th edition. There's almost no physical copies left. If you have one, guarded because the ninth edition, safe pride and flow to the ninth edition. But it's gonna be a great tool for you to find out all the different benefits that are out there. There are federal benefits and there's state benefits. And I like to think of them almost like a railroad tracks. Sometimes you want to use federal, sometimes you want to use state, sometimes you want to use both. So this book, in conjunction with the federal guide, using both of those and looking at all the opportunities that are out there for yourself, for your family members, it's just a great tool. If you're using the online version, it allows you to search a little faster for information. But the ninth edition should be out pretty soon. I was on the team that helped write it, so I can answer probably a little bit more questions than most people. But I don't have any superpower, and you know, California, you write something great, it'll go back up to committee and get redone a different way. Next slide. So that's today. That's where we're at. This is what we're going to talk about. Go ahead to the next slide. I kind of like this slide just because it talks a little bit and shows you the California Transition Assistance Program. That's where I work at. So California actually employs a lot of people to go out to different military bases, to events and stand downs. And whether you're calling or emailing, it's going to be myself or some other technicians that are out there to just really help you navigate through all the different programs that are out there for veterans and their family members. In addition to that, we do a lot of online events as well. The advantage of the online events is that you can literally be anywhere and just join us and participate. So like, let's say earlier about some of the home loans programs and some of the things that we do. If you're not able to get all the information or you want to do a deep dive, I can navigate you towards one of the online events that we either have coming up or that we've already had, so you can go enjoy it and get some more information about how the home loan process works and how California is a little different. So next slide, please. This is a snapshot of all the different organizations out there to help veterans and their family members. There's the federal VA, which everyone's pretty familiar with. And I know they kind of got a bad rap because they've been shut down a little bit over the last few weeks, right? But it's the way it goes sometimes. But the federal VA is the overarching agency that provides a lot of benefits and information for people. Each state has their own individual Department of Veteran Affairs. So whether you're in Iowa or Nevada, California, actually, we've got one of the bigger ones. And with a veteran population of almost 1.6 million veterans, we have a large footprint. The state even puts out 8 individuals whose whole role is just to walk with veterans and their family members through different checkpoints that you may have in different moments that matter. Phenomenal the work that they do. And the one for this region, for the North Valley, is Cole Wagner. And great guy. Unfortunately, he couldn't be here today, but get me instead so I can answer some questions for you. And then you can see there's some civilian agencies that work in conjunction with other veteran programs to help you navigate through some of the stuff that's out there. Because California does have 58 counties, it can get confusing, but each county has their own county veteran service office. So whether you're in Sacramento, Placer, if you're down south in San Diego, one of the life hacks is you don't have to use the county veteran office that you're in. So for example, if someone is in Inyo, I might send them to Contra Costa because they can do it online and just use Zoom and have that conversation and do everything over Zoom. A lot of the paperwork that you might need filled out or signed can be signed by PDF. So it doesn't necessarily mean that you have to physically go in the building. So if you're in a more rural location, I may send you to one of the county veteran service offices that has the ability to give you those online appointments. And then, of course, people move throughout the state all the time. You can just use anyone. It just helps you out. Also, again, another life hack. You want to go to where the money's at, right? Counties with a lot of money tend to be a lot faster. Next slide, please. So California Department of Veterans Affairs, our mission really is about everyone in this room. We're here to make sure that your rights are protected as a veteran, but also that you know that the state of California respects everything that you and your family's done and in your military service. And we're just the advocates here to walk with you through the different programs. But whether it's a program that's held specifically by the state or by the federal government. We're just here to help you navigate through all those. And there's a lot of different programs and outreach that we do as a state. I have found that if it's usually either funds or compensation, it's a program that's wrapped into the federal government. And if it's a waiver or removal of fees, it's a program wrapped in by the state. So sometimes people will say, hey, you run that program. It's just a good general tool to help you navigate to where that program is already used. Next slide, please. So this shows you just some of the different California specific veteran benefits. And the biggest one that a lot of people have questions about is the college tuition fee waiver for the dependents of veterans who have a disability rating. I'll go over all these in detail. Go ahead and go to the next slide for me. This just talks a little bit about where I said earlier, the local interagency network coordinators. Those are the 8 different individuals that the state places throughout different regions to help people walk through whatever challenges they're having, whether it be with paperwork or getting services, or they need to get networked with different organizations for veteran benefits. Next slide. This is the map showing the different local interagency network coordinators, where they're at and how to contact them. If you're in Northern California, and of course, all this information is out on the table out there. And if you guys need a PDF copy of this slide deck as well, we're happy to issue a PDF copy. Next slide. This just talks a little more about what they do as individuals and how they help navigate people through different emergencies. A perfect example is the Palisade fires that happened in the beginning of January. The local interagency network coordinators were down helping all of the veterans who lost their homes, lost all their medals, lost all the tuition work. And then, of course, the state of California sent myself and my teammates out there to help as well. We're operating 3 different disaster response centers where I believe the number they gave me was like 98,000 people were helped while we were there in those rooms. So a lot of work that we're doing. That's just one example. Next slide, please. So a real popular program that we have is tuition waiver for the dependents of veterans who have a disability rating. So I think that one thing I want to make clear in the beginning is that when it comes to California, a lot of states you either have to enter or exit service from that state to be eligible for the benefits. That's not how it works with California. As long as you're here or the person is eligible for those benefits, you're good to go. So it's not really like a requirement of entering or exit service. With this program specifically, it's just designed to help the children and dependents of veterans who have that disability rating, whether it's as high as 100 or it's as low as 0%. It just allows your dependents to go to any California state school, whether it's a community college, a state university, or a University of California, and have the tuition waived. Without getting too complicated, there are 4 different categories in the program: A, B, C, and D. Most people who are in the National Guard fall in Plan C. In my opinion, Plan C is actually the best one. So it's kind of cool. But take a look at all of them. And in that book, the Veterans Resource Guide on page 120, it goes into a lot of detail about that program and how it works. And of course, I'm happy to answer any questions that you have while I'm here today about this program. It does cover the tuition. It doesn't cover like books or room and board, but tuition obviously can get tenants, right? So having that waived is a game changer for a lot of people. Next slide, please. This talks about the different plans. Plan A is if the veteran has 100% disability rating, and with that, there is that allows the spouses to have that eligibility to apply for this. I think the real difference is that there isn't age limit for the children under this program. Fun fact, if you decide that California is just not the place you want to be, and you want to move someplace else, your children are still eligible for this. You don't have to be a resident. Residency is based off of this place. Next slide, please. This slide talks a little bit about Plan B, which is the next category. Plan B is more income-based. If you have a disability rating from 100 to 0%. When we say income-based, it can kind of throw people off because they think of their income, and it's actually based off of the student's income. So as long as the student is making under what is the California state poverty limit, which of course changes every year, And please don't quote me on this, but I want to throw out a number so that way people can get an idea. I want to say it's like 22,000 a year. Most students aren't making that much money, but as long as they stay under that dollar amount, then they're eligible to continue to go in college. Next slide, please. Plan C, this one kind of removes the rails of age restrictions and income restrictions. So as long as you're eligible under Plan C, then your dependents are eligible to get that tuition. And the Plan B is if you're that superhero hard charger Captain Mel Lavon, come see me. I will walk you through the process myself. Happy to do that. Next slide, please. This talks about some of the California veteran DMV programs. If you are a veteran in California, this encourages you to get that veteran designation on your driver's license. It's something that you've earned, so you should be proud of it. Also, when you go to different places, sometimes they'll allow them to unlock different benefits and different programs for you. I've heard people say that it makes it easier because they don't have to carry their DD-214 with them all the time. But obviously that's different paperwork for different things. But that was better than my kids are always buying video games, so they can take them to the GameStop and because they get a little discount there. So they love that. If you have a disability rating that's 100% and it's mobility related, the state of California has a program where you can have the registration for one of your vehicles waived. That will also allow you to apply specifically to fast track so that you can also waive the bridge fees and some of the toll money. But that's specifically to fast track, so we're talking about this. There are, without being too confusing, we have a license plate program. There is 76 different types of iconography you can choose for your license plates. But if you have a special recognition license plate, whether it's Purple Heart, Gold Star, there's a few other ones that are special recognition. With those as well, it allows you to go to those things before. So it's just something you want to make sure people are eligible for that they're getting these in the state. If you are someone who works with a commercial driver's license or you use a lot of heavy equipment, you have a program with the state of California where you can try to receive your commercial driver's license. Just over real quick. It's something that I do recommend you can choose something you are eligible for. Next slide, please. California has a lot of beautiful landscape and open space. Go back one? Sure. It's that CDL program? It's the Even Exchange program. So if you are someone working with heavy equipment and vehicles, it just allows you to apply directly to the Department of Motor Vehicles and
So
try to
that's
get it.
like a 88 mile, qualified program, manufactured type.
Yeah,
So you got a 88 mile program. right?
Yeah, and what
Yeah.
it is too, sir, is like the 88 mics, they have their 348s. Yeah, that's what would be
That's
used
the
in
part.
addition. Yeah,
Okay, all right.
for the vehicle.
This one by that.
I got you.
CDL. I got you raised.
Well, I want to make sure you get the best information on that. So come see me afterwards and
No,
we'll,
I know, that's what I thought it was. I
Okay.
just wanted to make sure there wasn't something else.
No, yeah,
Okay, thank you. Okay. Good. Unfortunately, I'm not an 88, so.
it's all right. Hey, you'll be surprised. You'll be surprised. I always tell people, look into those programs because a lot of times there's waivers. So you may not be X, Y, or Z, but you may be able to look into it. DMVs, every now and then DMV makes it easier. They do a lot of online testing too now, which you wouldn't think that people doing testing from home.
Oh, yeah, the 17,000 recalls.
Yeah. Yeah.
Okay, thank you, appreciate it.
California, hunting and fishing licenses. If you're someone who's into hunting and fishing, you have the ability to apply for a reduced cost hunting and fishing license. If you have a disability rating of 50% or higher from the VA, the state of California will allow you to apply for your annual hunting and fishing license. And I want to say the combined price is like $9.99. California also has free hunting and fishing days. These show the ones from last year.
So the ones from next year will be around the same time. But it's just a program to allow people to enjoy the green spaces more and get out there and really enjoy the outdoors. Next slide, please.
That can come to, so. Third one, but no, second week of third.
Yeah, the day changes every year, so yeah, I keep moving it. But definitely with it. If you have not applied for the Federal Parks Pass yet, it's something that I definitely recommend you listening to. Federal Parks Pass will allow you access to over 2,000 different locations for you and your families to enjoy. The coolest place I've been so far in using that was in Puerto Rico. They got some pretty cool castles over there. Who would have thought, right? U.S. territory. California also has a Parks Pass as well for veterans. I always encourage veterans to apply for that. Some of the literature will say that you have to have a 50% disability rating, but all the veterans that I've talked to that have applied for it have received it. It allows them to just enjoy some of California's parks. There are 280 different locations throughout the state that are designated as parks for you to enjoy. So check it out. California also has another program where you can check out park passes from the library. So if you're talking to a different family who's not a veteran family, they can also go and check out those park passes from the library as well. Gives people an opportunity more to enjoy the different parts of California. Next slide, please. This just shows some of the different types of passes in the federal government. If you're on active duty in the military, they'll give you the active duty military one. And then if you are a veteran, you're going to apply for the veteran lifetime. That way you only have to apply once. If you do it online, there is like a $10 processing fee. But if you go to any of the federal facilities that offer these parks passes, you can go in and with your information and get one at no cost. Next slide, please. This just talks a little bit more about the Parks Pass program and how to get more details into it. And again, if you want to copy this PDF, we'll make sure that you get it. Next slide, please. Business and tax programs. So with 58 different counties, it can be a little crazy trying to get the right form every now and then. But if you are a veteran who wants to start their own business, a lot of the counties have programs to help you waive the cost of your business taxes as a veteran. I always recommend that you look into that. Additionally, in the state of California, they have a program where if the veteran has 100% disability rating, they can waive their property tax. There's always new legislation coming back and forth trying to get them to lower that benchmark from 100% and make it so that all the veterans have it. I see a hand back there.
Yeah, it's the requirement that the third state of California, they're Senate. Like I'm here, they bring $168,000 off the property tax, but not close.
Yeah, they do that California math. It does get a little, there's like a bunch of different counties. What I always tell people is talk directly to the county assessor's office and they'll give you a form that you need specifically and they'll walk you through the process. You have an excellent point. And so I wish it was 100% of the taxes were not, but they do it in their life. Yeah, the more money you make, the lower the percentage.
Still, if you're trying to expect them back in the year.
Absolutely. It can work out to 3,000, 6,000, or even more depending on the size of it all. If you are a veteran who has a business and you want to do business directly with the state of California, there's a few different programs that we can turn you on to, so that way it can make it a little bit easier to do business with the state. If you're a veteran who is doing business with the state and you have a disability, the state has a special program just for veterans to own that type of business. And it's called the Disabled Veteran Business Enterprise. Their whole role is to navigate you through doing business with the state. Why is that so important? Well, first of all, if your business is doing business with the state of California, it adds a huge amount of legitimacy to your business. Because I know if I'm a customer, and I've never heard of you, and I hear that you're doing business with the state, and I'm like, okay, cool, let me jump onto that. But also, the state of California has to do a certain percentage of its business with disabled veteran-owned business. So it just maximizes your ability as a business. And also, the state's gonna share your information with the county and the area and the cities. So as a business, your marketing footprint just gets that out there. So just a good program to help out. Next slide, please. This goes into more detail about that program and how it works. And again, if you got questions, you can come see me after this, and I'm happy to answer them for you. Next slide, please. Within the California Department of Veteran Affairs, there are many different divisions. There's a home loans division, women veterans division, minorities division. We're going to talk about some of those and some of the different programs that they have. Next slide, please. This is the Veteran Services Division, is what I work for. And this is our website, calvet.ca.gov. This will just help you navigate through a lot of the different programs and opportunities. If you got questions or if you want to have a look back on the conversation we had today, it's a great place to start. Also, if you want to download a copy of that veteran resource book, you'll find it on our website. Next slide, please. Go again. Just highlighting some stuff. You can go to the next slide. It doesn't want to go? That's okay. We don't need the slides. I can stop. What are some of the great divisions? Well, one of them is the home loans division. The home loans division has been around for over 100 years. And one of the things that they specialize in, because they used to be the farm and home loans, because back in the 1940s, everybody was trying to farm, right? Well, the cool thing is with the home loans division is what they do is they take their federal benefits and they align them with the state benefits. And by doing that, it really allows you to use both set of benefits. So when you get a VA loan, the VA loan is a guarantee. It's the federal government saying, hey, regardless of what happens, we got you. We're going to make sure that everything's good. Well, with Calvet, instead of Wells Fargo, Bank of America, Chase, whatever, being the lender, the state of California becomes the lender. So you have state employees whose whole role is just to make sure that you get the best benefit out of what you're doing with that home purchase. Also, they manually underwrite all the loans. So they're not looking at a person's credit score. If you have a disability rating of 10% or higher, you're eligible to have a lot of the funding fees waived, which is, it's a game changer for a lot of people. Also, if you're someone who's purchasing a larger house, there's no extra fees or points for a jumbo loan. It just doesn't work that way. You're just having the state of California help you out. If you are someone who's purchasing a home in an area where it's harder to get insurance, that doesn't become an issue because you're insured by the state of California. So it just changes a lot of things for people trying to purchase a home. And go ahead and go to the next slide for me. This is their website, and this will allow you to, their application process is incredibly fast. It's going to be one page, and then they're going to call you back and talk to you and get more of it up. But go to the next slide. This will give you an idea of what their maximum amount are for that loan. Question?
With a 90-day activity period, qualified for it, the guidance is 8 hours, or more or something guaranteed.
That's a good question. What do you say that again, please?
So for like soldiers that may and willing to have active duty periods, like full-time orders, but it's ADOS versus like a SASO or.
Well, you were on active orders, GDOS, ADOS, or anything like that in more than 30 days. Okay, more than 30 days, which you would know because you would have qualified for BHA. Okay, during those orders, you meet the standards for being on active duty. Somebody could check that for me, right?
Sure can.
Okay. So
Soldiers I asked, I know a lot.
you don't have to be on Title 10.
Yeah, they're just like the 9/11, like the do I go 9/11?
Mhm. That is. That you would need to check.
That's a different.
Yeah,
So that's why I was asking.
That's a different benefit.
those benefits are linked towards a combat zone and that, but you need to check that exactly, because again, I wouldn't know what GDOS or whatever you were on.
Yeah, no, it's just generalized, but that's how they specify, like, that's specific qualifying things, and some are, some periods are not qualifying. So I was wondering, like, 90-day activity period was separated the
For the-
same. Or
For the purposes of that, yes, you would qualify.
And let me just bring a smile to your face because the standards for federal and state are totally different. Like the state, they're super chill about that. And if for some reason you didn't qualify, all you have to do is ask and speak with one of the management, and I guarantee you they'll find you. You'd be surprised. Their whole role is just to help you forget it. And if the problem is that you're like 10 days off or something, exactly. I think you'd be pleasantly surprised when you look at it. The people, it's the whole second floor of our building, and they've been able to. Next slide, please. This just had to look back about some of the things I said, and then of course they'll give you guidance on a lot of mortgage assistance programs. So one of the crazy hidden jewels is a lot of counties have mortgage assistance programs. California wants people to buy a home and they want you to stay. So different counties will play different games. So for example, Placer County might say, hey, we have an extra $120,000 people for you for mortgage assistance programs. Come here, come buy a home in Placer County. We'll give you this 100. You have to promise to pay this back, but you have up to 40 years before you start paying it. And it almost sounds like I'm joking when I say 40 years, but some of the numbers are like that. It's incredible, some of the mortgage assistance programs, the amount of money that, and their role is to just help you navigate, find those programs and walk you through them so that way you can get the funding that's out there. So if you just at home. Next slide, please. This is one of my teammates who really specializes in the home loan process. He actually just got an award the other day because he's been traveling throughout the state and helping so many people out. Phenomenal person. I had his information, and whenever I have questions about home purchasing or home loan, first person to talk. Next slide, please. Women's Veterans Division. They just got a new department secretary, and she's phenomenal. There is a lot that our wives or sisters and our moms have all done to really make America great. And as veterans, we need to make sure that all those special needs get addressed. Watching, I've been to like 3 different events with the Women's Veterans Division within the last 2 months, and they just do a phenomenal job. So definitely something worth checking out. I recommend that you sign up for their roster. They have a lot of programs, a lot of advocacy, and a lot of outreach that they do for women veterans. Next slide. This just shows you a link to their website and gives you the opportunity to sign up for their roster. Next slide, please. Minority and Underrepresented Veterans Division. Their role is to reach out to the underserviced veteran community. I've been to an event that they put on 2 months ago in the Bay Area to help out with some of the transgender veterans. I've been to an event up in Crescent City last month with some of the Native American and Indigenous warriors and veterans that we have. There's a lot that they do to just reaching out to the underserviced population of veterans that are out there. Additionally, a lot of veterans who have questions about citizenship, this department's there to help them out and help them navigate. If you go to the next slide, it'll give you an opportunity to just take a look at some of the stuff that they do and some of the outreach that they perform. These are divisions that California puts out there just to make sure that we're respecting and protecting all of the different veterans that are out there. Next slide, please. This is the CalVet Veterans Homes, and it kind of gives you a map. So I'm just eyeballing the room, and I can see that no one in here is ready for this conversation just yet, but eventually we're going to have a conversation about getting a little bit older. And one of the things that we can all probably agree on is that we want to be someplace where we feel safe. with 8 different facilities throughout the state of California and some of the highest level of care, these places are phenomenal. Now, a lot of times the conversation is, hey, I'm not ready for that yet. They have a lot of regular apartments that are attached to some of these facilities as well, that are like across the street or next door. So when I was down in Ventura a couple months ago and I was talking to the team at the Ventura Veterans Home, I went over to some of the apartments they had. Ventura is kind of an expensive part of California, and their one-bedroom apartment started off at $600 a month. So I was like, man, if it's changed for me, I'm moving down there. But don't just think of it as some place for retirement. It's just a place where there's a lot of housing and a lot of availability. Obviously, if you're someone who needs skilled nursing, they have those facilities. Also, they do memory care and assisted living as well. Go ahead and go to the next slide for me. This just talks about what they require people to be in that facility. Sometimes they do require a percentage of your income, but there are ways to waive that requirement as well. So it's just something that when the time comes, if you're looking for that tomorrow spot, it should be a conversation to have. When I went to the one in Napa, I was pretty impressed. Everybody was riding around with golf carts, drinking wine, having a good time. I had to stop for a minute and go, okay, well, maybe this might be the spot for me. Bless you. Next slide. And this is their website to go into more detail about some of the stuff that they have and some of these programs. Maybe you know an older veteran who might be interested in it. Or when the time comes, you can have this conversation with me again.
This one's a nice one that everyone else is giving to.
The one in Napa is really nice.
Napa.
Napa, Ventura is nice. I like the one in Ventura. I haven't been to the one in Redding, but I heard it was cool. The one in Barstow, if you're into that kind of weather, that one's cool. I've talked to some people who were there.
But aren't there some rules like you have to be placed into that care home before you are need care?
I understand your question, and the answer is no. So if you go to a place just that just has living, just a regular living facility, and then you transition into where you need care, then they'll pick you to the top of the list. But it's not a requirement that you have to have or need care before you apply.
Do you know if you can still have at home, like?
Absolutely.
family things still,
Absolutely. Yeah.
Like, go
It's not prison. Yeah. You can go if you want.
So ladies.
Right now, from what I'm told, there is a little bit of a waiting list, but it's peaks and valleys. Last year, there was no waiting list. And right now, there's a short one. I think it's like 2 months. Next slide, please. Cemeteries and Burials Division, when the time comes that we have to have a conversation about our legacy and what it's going to look like, there are several federal facilities throughout the state of California. However, the state of California also operates its own veteran cemetery. The one in Redding that I went to that one 3 weeks ago for the first time, absolutely beautiful. The one in Seaside, I haven't been to that one yet, but I think when the time comes, I think I want Ocean View. That might be the one I take. It just gives a lot of people opportunities to just pick and choose and be a little bit closer to wherever they want their legacy to be. They're also building a couple of other facilities in the state of California. I know that there's one being built near Alameda area right now, but it's oh my goodness, I'm trying to remember the word. Hard to pronounce. Columbarium? The Columbarium. It's just for people. Columbarium, that's it. Yeah. They're building that one up in the Alameda area. It's supposed to be done pretty soon, but that one's supposed to hold 100,000 heroes. It's not done yet. They're going to continue building. The state of California is building another one of its own facilities down in the Orange County area right now, too. So, next slide, please. This just talks about the Cemetery and Burials Division, talks about some of their opportunities. There is a pre-burial packet that I recommend people at least take a look at. No one ever really plans on dying. You know, sometimes it's kind of inconvenient what happens for all of us. I've had a couple of people in my family that passed away and having the ability to give them a veteran funeral really not only honor their legacy, but honestly, it's a lot more affordable for a lot of families because it can be expensive and our loved ones pass away. Next slide, please. The Sacramento County Veteran Service Office. This is just going to give you a quick snapshot of their Veteran Service Office and what they do. A lot of the counties offer the same different services. So whether you're in Placer, El Dorado, Sacramento, this is just gives you an idea of some of the services they perform. Next slide. You can see whether you're looking for yourself, your dependents, or survivors. They're going to have claims officers, and they're going to be people who are VA accredited. Do not use any of the claim sharks or people who are like, oh, just give me, $1,000 and none of that. You want someone working for you who is a professional who does this 24/7, because you need someone who is going to understand the VA's language and how paperwork needs to be processed. And you can see last year, the County Veteran Service officers throughout the state of California brought in almost $600 million of funding for veterans and their families, or new funding for those people living in California. Next slide. So whether it be counseling, claims assistance, whether you need signatures, because some of the paperwork that you're going to process has that signatures from the County Veteran Service Office. It can be confusing sometimes because you may go to the DMV and the DMV may talk to you and then they say, hey, we need you to go to the County Veteran Service Office. But I want you to think of it like this. The certifying officials, people who can look at the paperwork and sign it, are always going to be at the County Veteran Service. So if it's a document that needs a signature, you're probably going to have to start off with one of these documents. It's just good for you to have an idea of that. And then whether it's programs for the college fee waiver or just helping with a records request, they're just here to help you out. Just in case I haven't said it, I want to make sure I say it. There's no fee ever for using the County Veteran Service Offices. All these different offices are just here to help you and your family members navigate through different stuff. Next slide. And then that's their contact information. I got a bunch of handouts for them up front, and I printed up the ones for Placer as well. Some people might live in Placer. If you live in a different county, let me know. I have the list. A lot of the numbers I can memorize because I answer the phones where I work at too. So I'm happy to help you out with that kind of stuff. Sacramento is a good office. Rochelle, Arnold, Tim, the whole crew there, they do a really good job. So whatever you need, they can definitely help you out, even if you don't live in Sacramento. You get a lot of people who call from overseas, out of state, and we still help them out because California has such a large footprint and has a better ability to help people out in those situations. Next slide. This is my team, and we're just here to, again, to help everybody. So if you have questions, you want to check out some of our webinars, you want to go and look at some of the videos that are up there, or you want to join us for some of the events that are coming up, by all means, we just ask that you use a non-DOD email address so we can just continue to have that conversation with you later on in the future. But when you pick up that book, because you'll get the newest copy sooner or later, right? And you look at that 1-800 number, it's going to be me, it's going to be my teammates, and we're always happy to help you out and answer whatever questions you have. I am honored not just to be a state employee who's here to help you out, but I'm also honored as another veteran to be here to help you out. You can always call me and ask me any questions. I'm happy to share all my contact information with everyone. And it should be on the next slide, allegedly. Well, the next slide, go to the next slide. There you go. There's the contact information. We'll leave that up for a while. And then if there's any questions that people have while I'm here, I'm happy to answer them. I got one over there. Fire away.
Jeremy talked about one of the Veterans Homes Program for people who, so the federal VA program where you have a, let's say you have a rental car. Kind of like Section 8, you can opt into a program for the VA and you don't put veterans in your house. Is California, is there really talk about that? Is California how that side for finding homes for veterans?
Okay. Yes. So there's a whole program called VHHP, Veterans Homeless Housing Prevention. Bad marketing, great team. What they do is they fund millions of dollars for any type of veterans housing that's going to come up.
So if you, are you building a place yourself or are you just kind of?
No, it's just. Something back, right? Like if you have a property that.
Yeah.
It's like a property that's already paid for, and you want to offer it for a greater good.
Yeah, oh, well, so Tom Johnson is the person who's in charge of that to me. They go throughout the state. They just put out a list of new housing that they built for veterans. I saw the list and I was like, okay, it's kind of overwhelming for one person to read. There's a lot that's going on. But yes, absolutely, California does that. In addition to that, there's two different programs. One's called Home Key, I forget what the other one's called, but they're navigating a lot of funds towards getting, not just getting veterans into housing, but to building housing specifically just for veterans. So there's a lot going on with that. Yes, sir.
Just sort of a question for, the college benefits, we're talking about when I forward to the United area, for 4 years, but the mission is next school afterwards. Is there anything that helps cover some of the findings for the veterinary school itself after they left with the college?
Well, if it's because the basic answer to your question is yes. If they're going to a state school, then there shouldn't be any problems having those tuitions waived. If it's a private school, then you want to look into the Yellow Ribbon program. Because the Yellow Ribbon program will encourage the schools to either lower their costs or match it to different source. So those are the two. And then specifically for that,
For the veterinary facility, it's like 20 years of, years of, and they have to do with veterinary. They will help after that. So it's not where I'm saying. I know the like, I can plan, I just might go on the call.
well, the goal would be to have those, to have the tuition waived. So I would look to see what UCs or CSUs offer that program. And then just have to wait. That would be the easiest way. What I found working this job is that whenever people ask questions like that, I've always found that there's a school somewhere to go, and it's amazing. Someone asked me a few months ago, like, hey, how do I go to med school for free? 15 different schools that I could send them to. Some of them were out of state, right? But there's always that one. So we just have to have that conversation, and we have to figure out which school in the UC system offers that. And then we just have it with. That'd be the easiest way. California is great about removing fees or waiving tuition, but as far as like writing checks, I'm not so good about that. Federal government is, and then the other half of it would be, as you already know, there's a lot of scholarships that are out there. You just navigate through some of the scholarships that you guys. There's always going to be additional costs and all that stuff. Is there a question over here? No?
We do have a few questions online.
Shoot.
First question, can I use the program to help my parents with dementia?
For eligibility for the parents, it would depend on if they're listed as dependents. So I wouldn't be the best person to answer that question. I would have them talk directly to the facility that they would want to enroll in.
Okay.
I wouldn't, but it's, yeah, it's a good question. I don't know the answer to that one. I would have them talk directly to the facility. So if they're, the one in Napa, the Yountville facility is the largest facility and it's been around since like 1880s. They have a huge staff. I would ask them. And if they're not eligible for that program, then the federal government has an aid and attendance program. I would apply for that one. And I will make sure to get the person the information for aid and attendance.
Second question, can retired veterans live inside an active duty base?
Inside an active duty base?
Is that the answer?
Yes.
I mean,
So when you retire, it doesn't matter if you're active duty or if you're a reservist. That is an option for you. But just remember, when you retire, retired reserve, you just gotta wait. You gotta wait until you, the whole thing is based on when you retire. So National Guard members, you actually do have that opportunity but you're gonna have to wait till you receive your retirement, order. So remember, you get gray area retirement, retire reserve, you do your packet, then HRC is gonna send you your retirement order. Once you get that retirement order, you're authorized to live on any base that you want, as long as there's availability. So it's all dependent on availability.
Question caught me off guard. I don't even like living in HOA, man. I live on base. I'm trying to live that.
So same thing. So when you're retired, you go under a different thing. They're gonna go off based off of your rank. So officers are different, obviously we all know, as enlisted are too. So most of the time when you go on most bases, you'll see they have an area for lodging and housing for like people that are TDY or whatever. That's the area you're gonna live in. Those are the areas that are designated for the retirees. So you're not gonna be like main post, but you'll be pretty close to it. No, it's not. But like I said, it's availability. So obviously active duty service members have that priority and then it goes to retirees. Anacostia Bowling is a very good one. It's in DC. Anacostia Bowling, it's in DC. It's right off the Potomac. It's really good. If you want to live there.
Why? Next question.
That's it.
That's it? Okay.
Hey, John.
Well, thank you for having me. And again, I'll be outside. I've got the table over there, so if there's any other questions, I'm happy to answer them for you. Feel free to share my information with any other veteran families. We're just here to help anybody. Thank you for having me today.
Okay. And just remember too, because this is Cal Vets, also remember when it comes to the education, you also have VA that you can also reach out to. And those are on like the VA benefits, that information on the bottom of your agenda. That's who you reach out to, and they can help you also with answering education and because you know there's Cal Vet and then you also have VA. And they have all the different programs. They
Absolutely.
follow the same program, but VA might be able to help you answer some other additional questions when it comes to education. Is that good?
Yeah, and again, what I said earlier, if you look back on that, if it's compensation or funds that's coming to you, it's probably going to be from the VA. And if it's a removal of fees or a waiver, it's going to be from Calvet, from the state. If you are having challenges and you're trying to get retrained or back into the workforce or go back to school, there's other organizations within the state, like Department of Rehabilitation and things that we send people to. They may not qualify for a VA rating, but they qualify under the California State Department of Rehabilitation. So there's always a way, you know, we just got to kind of figure out what works best for people because everyone's situation is a little different. And it's just our job to help you navigate through those. Thank you again.
Okay, so we're gonna go ahead and go on a break. As long as can you guys be back at 10:40, and then we'll have civilian ed, financial planner, or financial the PFC counselor, and then it'll be me, and then we're done. Paula?
You can go.
You can use the stage or you want to?
Are you for?
I'm gonna try to be a little bit informal. Does my voice carry enough? Is it okay? Okay. So good morning. Welcome to our education benefits discussion. My name is Paula Blongen. I work in the Civilian Education Department. I am the education technician. So I'm kind of the first line that you might come across when you're asking questions for education. And then when we get a little more into the weeds with it, then I may have you speak with some of our little more expert to that particular thing. So today we are going to start with what benefits that will be terminated upon separation, what benefits you can use after separation, the GI Bill benefits, the eliminating periods, how to apply to use the GI Bill benefits, enrollment verification, transfer of education benefits, also known as TEB, and then additional resources that we can hand out for you, and then points of contact so you can get a hold of us in case we need to take a deeper dive into your particular questions. And that's the thing to remember is that even though the military says we're not individual, we kind of still are to a certain degree. Our profiles all look different in what we've done in our careers, okay? So sometimes it's going to take an individual deep dive to get you taken care of properly. Okay, so next, if you are planning to separate, we're going to have to talk about some of the things that you will actually not be able to use upon retirement. One of those is federal tuition assistance. That's going to go away. Chapter 1606, Montgomery GI Bill, submission of TEB requests. So you won't be able to submit any more TEB requests after that, but we'll talk about that a little bit further to clarify that. And then credentialing assistance will be something that you will not be able to access. So these are tools that we use for recruiting and retention. We want people to stay. Yes, sir.
I'm sorry, I should have spoken up earlier. Would it be okay if you stood on the stage to help your?
Will that help? Okay, here we go.
The microphone works too, so if you need to use a microphone.
Okay, how's that? Better?
Thank you.
Okay. You had access to the microphone?
It's on.
It's on. Okay, so I just told you about what you can't use, but here let's talk about what you can use. Okay, so you'll be able to use the Chapter 30, the Montgomery GI Bill active duty. Chapter 33 plus 911 GI Bill. The GI Bill kicker attached to Chapter 30 and Chapter 33. Financial aid and grants are always available. Your joint service transcript, we recommend that highly, also known as JSC. And then also available to you do the Veteran Readiness and Employment Program, VRNE. Okay, so next we have the GI Bill active duty Chapter 30. Yes, sir.
Yeah. 200%, terminated.
Let's move forward because I think that will probably be answered for you within our briefing. Okay. Okay. So active duty Chapter 30. This is a GI Bill program for soldiers who serve on active duty. To qualify, you would have to have qualified active duty service on or after 1 July of 85 or AGR service after 29 November of 89. You would also have to complete at least 2 years of active duty or AGR, which is title 10 or 32. Complete a mobilization of at least 2 continuous years, which is 730 days. Also contribute $100 a month for 12 months. And then you can actually plus that up and contribute an additional $600 each month. And if you do that, what do you get? If you serve for more than 3 years consecutively, at the 3-year rate, you get $2,518 a month. If you serve consecutively for 2 years, but less than 3, you would get $2,043 a month. You can use this with MTA, so if you're staying, you would still be able to use that in addition. And then, again, you have the plus up option, and that adds $150 a month to what you'd be receiving. Okay, with that, we have the kicker. And the kicker is an additional payment to your basic GI Bill benefit. And to qualify, you'd have to be eligible, first of all, for 1606 or Chapter 30. So you'd have to be able to qualify for either of those in order to get the kicker. You'd have to agree to serve in a critical unit, or I'm sorry, critical skill or unit. You would have to enter officer commissioning program or within 1 year of commissioning. You would have to sign a 6-year contract or service agreement, officer service agreement, and then meet some other criteria that's listed in the current kicker policy. So what do you get with that kicker? It's either $200 or $350, and that's dependent on your contract when you sign. There would be already written in there. And then in addition, you get Chapter 1606, 30 or post 9/11 basic GI Bill benefit. Okay. So post 9/11 GI Bill, Chapter 33. This is a program for soldiers who are on active duty. And to qualify, you would have to have at least 90 days of a period of qualifying service on or after September 11th of 2001. And you'll see there's a whole list of qualifying active duty service. So service in an active component, Title 10, and you'll see the sections there that go with that. So if any of those apply to you. Title 10 or Title 32 AGR. And then Section 502F of Title 32. And there's a listing of the different operations that are included in that, such as Novo Eagle and Operation Guardian Shield, etc. So those will all be counted. If you're awarded a Purple Heart, you are on the 100% tier, and your award order for your 100% needs to be in your IPERM record. I believe it's called an award order. Okay, and then serve in a qualifying duty status for more than 30 days and separate due to service-connected disability or injury. So that gets you, I believe that's the 100% tier. Does that help? Thanks. So post 9/11 GI Bill continuing, what is considered non-qualifying? Title 32, full-time National Guard, OS, ADOS, and ADSW, except for those things that were on the previous slide, except for those, okay? Other than that, Title 32 is not going to help you. If you have a service academy contract period, ROTC active duty contract period, an active duty used for active duty loan repayment, an active duty period receiving less than honorable discharge. And then if you've completed 24 months of qualifying service time, then they will let you roll in your basic training in your AIT that occurred on or after 9/11/2001. Okay, so that time's going to be counted. And that's a fairly new thing. Okay, and here's the tier payment. It's, you can see up here, it's just a chart that, lets you know that how many, you know, what do you get, according to the tier. And it goes from 50 up to 100. So you'll see at the top that, the, two that we get the 100% for is, the Purple Heart, and then the disability that we were just talking about. And so you can see it ranges from the bottom tier at 50%, at least 90 cumulative days, all up to the top where you get at least 36 cumulative months at 100%. And at the very bottom, you'll see that the payment tiers also apply to tuition and fees, your books and your supplies stipend, and your housing stipend. And those are all prorated according to the tier level that you are at. So if you're at 50, you get 50%. If you're at 70, you get 70. Okay. And so we'll take a look at tuition and fees in particular. It pays up to 100% of in-state tuition and fees at public schools. Pays private and out-of-state tuition and fees up to the VA cap of $29,920.25 annually. And then payments are made directly to the school. So you would not get any of that in your bank account. That would go right to the school. And then kind of the rule of thumb when it comes to when you have different benefits is that they go for the GI Bill last. So they would pay any scholarships that you've earned or gotten. And then after that would be FTA, and then any employer-based aid or assistance, and then the GI Bill would kick in after that. And then there's a yellow ribbon program, and you have to be at the 100% tier to qualify for this. The school that you choose would have to also would have to elect to participate. And you can get onto a website, the VA website, and it will let you know if your school in particular that you're going to is a participant of the yellow ribbon program. And the VA will match up to match up to 50% of the cost that exceeds the VA tuition cap. And this includes private schools and out-of-state schools. And the va.gov.gi bill is a great place to go to get more help on that. Okay, and then in particular, housing allowance. It's paid directly to the student. You have to be attending for more than half time. More than half time. And the payment that you would receive for BAH is equal to an E5 with dependents. And the amount is dependent on the zip code of the school that you're going to. So a lot of people have a tendency to head down to San Francisco to go to school there. So the higher. Okay. And then it's prorated again according to the tier. And then, so you'll see here it says not eligible while serving in a qualifying active duty status. So basically no double dipping on housing. And then the payment that you'll receive is $1,169 a month if you are only attending online or doing distance learning. So your cost of that, or your, what you get goes down if you use that route. Okay, so books and supplies in particular, those get paid directly to you. You get up to $1,000 per academic year, and those are computed at $41.67 per credit hour. You get a lump sum payment for whichever quarter, semester, or term. and that's paid directly to you. It's prorated based on the payment tier. Okay, so this is very much payment tier driven. And then you're eligible regardless of duty status. You can use this while on active duty or non-active duty. If your last date of qualifying duty is before 1 January of 2013, then you expire 15 years later. That happened to me. Okay, and then from date of last active duty discharge, if your last date of qualifying duty is on or after 1 January 2013, your eligibility does not expire. Okay? And then the delimiting date can be extended by qualifying service of at least 90 consecutive days. Yes.
I'm sorry, can we go back one slide, please?
Yes.
So for the not eligible while serving and qualifying active duty status, so if I transferred my benefits to my child, and let's just say I go on an active duty status, will she not get that housing allowance?
Can you run that by one more time?
So if my child is the one who has my benefits and she's in school, and I'm still in, and I go on an active duty status, does that mean she will not get that housing allowance while I'm on an active duty status?
You know, I would have to check into that. If you could stop by my table at the end. Okay, but yes, sir?
Yeah, no. She will get it. Yeah. Okay. So it's talking about if I'm the one who's in school. Okay.
Oh, okay, I got you.
No, you
I got
can't, yeah, you can't get by. Say you're an E6, you go on active duty, and we pay you by as an E6. You don't get to get also E5 foul pay
Yes.
with dependents. That's what that means. You can't double dip. You are receiving by at whatever compensated rate. You do not get the additional Bob benefit. Does that make sense?
Yeah,
Yes.
and that's where he said the no double dipping, so it's gotta be one or the other.
If you transfer to school. Big. Okay.
Okay. So I think we are books and supplies. You have one?
Yes.
Books and supplies, okay. So that gets paid directly to you. You get up to $1,000 per academic year. Again, it's computed at $41.67 per credit hour, lump sum payment. Didn't we go through this? Yeah, okay. Yeah, delimiting date. Okay, so delimiting date can be extended by qualifying service of at least 90 consecutive days. Okay, so that delimiting period is important. Okay. Good. All right. Okay. So how do you apply? You would need to go to va.gov. They're the ones who have the purse strings. So you would apply for your education benefits there and hit that tile. What do they need in order for you to do that? School name and course of study, your personal information, address, phone numbers, those kinds of things. Of course, your bank account and your routing number so they can start paying you as soon as possible. Supporting documents that you're going to need are your D214 and or your orders. And then it's always just good practice to make sure that you have all of your orders and all of your papers in your iPerm file so that you can get those accessed. And then we have a phone number here that you can call between 7 and 6 Central Time, Monday through Friday. But we actually suggest to you to use the Ask VA portal because they get back. I think they're a little bit quicker. And then you'll need to do an enrollment verification. If you have a post 9/11 GI Bill, students who receive monthly housing allowance and or kicker payments are required to verify their enrollment to continue receiving their payments. So you've got to keep them informed. And then, so for example, it says here, if your term starts in August, you will need to begin verifying at the end of August. And then again, log on to va.gov/education and then select manage your veterans education benefits. It's pretty simple. People have done it right standing at my desk and it's been pretty painless. Okay, and then once you're there, then verify your enrollment. Okay, transfer of education benefits. We get lots of questions about those. It's a GI Bill incentive program that allows soldiers to transfer their post 9/11 GI Bill benefits to spouses and dependents in exchange for continued service. To qualify, you have to be serving in the armed forces and you have to have completed 6 years in the armed forces and not have any adverse action flags, including APFT and APCP failure. And you have to agree to serve 4 years from the transfer date of request. So if you're going to be getting out, you might want to stop by and have a conversation with us so we can open up your file and check and make sure that you are within our timeframes and that you don't go too quickly. So you have to initiate the benefits still while you're serving, and we always encourage people to do that just right off the top if you can, just get that done. And then after retiring or separating, you can revoke or modify modify only existing transferred benefits. So if you have given them to a couple of your children, and then somewhere along the way later, you have another kid that you've gotten out, you can't add that child on, but you can still transfer whoever's on your DEERS people, who was ever on your TEB. So we can open up your profile and it will show us that you have like 4 dependents or whatever. And you can move those through those 4 dependents that are already on there. But if you have a child later, you cannot add them on if you have gotten out. Okay, does that make sense? Okay, no late entries. Okay, so you can transfer remaining months of 9/11 benefit for up to 36 months of benefits, whichever is less. Again, your DEERS eligible dependents. Your spouse can start using them right away. And some payments is eliminating dates as transfer soldier. And then children, you have to transfer before they turn 21 and before 23. You get a couple of years if they're a full-time student. You can take that all the way to 23 instead of 21. Wards or foster children must have lived with a sponsor for at least 12 continuous months to be able to access this. You can use after the service member has served at least 10 years in the armed forces. And children can use as early as age 18 or receive a high school completion equivalent certificate. And then they end at age 26. So once your kids hit 26, they're done. They're off the books. Okay? Or when benefits are exhausted, of course, whichever comes first. Okay? So you still have until you're 26 and then they're off the books. Okay, how do you apply? Again, you would contact the DVA at the phone number and you can determine how many months are available to be transferred. One of the things that we always ask you to do when we talk to them is don't ask how many months do I have? Ask them how many months have I used? Okay, how many months have I used? And you're going to complete the form 4836 if you need to do that. Ensure your extension and current NGP 23 is uploaded into iFirm. MilConnect is a great place to go. You'll need to use it in this case also because you're going to apply online there and then follow the instructions sent to the military email. And then You will return to Mill Connect, print your approval letter, and write down your obligation end date. Okay, again, before you get out, check and make sure that you are within your time frames, because they will come after you to recoup, even if you get out a day early. So don't do that. Please, please, please stop by and see us. Okay? And an important reminder, you have an approved transfer of education benefits for your dependents. If you voluntarily separate from the ARNG prior to completing your service obligation, your TEB will be terminated and any funds paid to your dependents will be recouped. And then finally, FAFSA. I know that probably sticks out to a lot of people. I've got a senior in high school and we've been doing FAFSA like crazy for several days now. It's a federal student aid which offers grants, loans, and work study and more help to help you pay for college or career school. It's a free application for federal student aid to apply, and you would go to studentaid.gov. And it's actually so, it's really handy. Back in my earlier days, everything was paperwork, write it out. This you get online, it takes you like 20, 30 minutes. It's pretty handy. Okay. And then joint service transcript, GST. We strongly encourage you to get a hold of those. And if you're going to a school, turn those in and see if you can turn your military work into college credits. It's better to get some than none. If they give you 20 credits, that's 20 credits you don't have to pay for. So get those turned in and see if they will take. In most cases, they pretty much take off of everything. So turn those in. And then there's the website there that you would go to request your JST. And then again, most colleges have their military liaison there that will help you through. Okay. And then we have some helpful links. I know some of you will probably want to look at that. And you're always welcome to call us, stop by, email us with any question you have. We will certainly get you to the right person and get you the correct information. And here's our points of contact. Right up at the top there is Chief Fay, our fearless leader. And then next is Sergeant First Class Mary Segan. She's located down south in our unit down there. Mr. Anis is our education service specialist. He sits here in the G1. And then me, Paula Joanning, the technician. I deal a lot with the transcripts and testing, that kind of thing. And then we have Bree Albrecht. She's our HR specialist / GI bill manager / marketing / SWAT team. She's pretty good at what she does. She's got all kinds of answers. And you are certainly welcome. Again, you can call us at that 800 number there. You can call us at our individual desk numbers. The Civ Ed box down there at the bottom, those are great places to drop questions. And it's encouraged to drop them there because any person will be able to grab those. So if somebody happens to be, like you emailed me and I was out on leave, then you're gonna have to wait. But if you put it in there, then you'll get an instant response. Okay. We have some social media spots. And if I can keep up with.
Got a question from you.
Yes, sir.
We received any guidance since 2024 on the Supreme Court ruling with MGIV reinstatement, and as what's that process?
Yeah.
So we'll use me as an example.
Yeah.
Okay. So I have MGIV. I waive it. I waive for post. I take my post education benefits and deliver them to my children. My children go off to college. would I be eligible potentially for NGIB reinstatement upon retirement? Because I fit into those categories potentially. So
Okay.
do I get to go back to school if I want to go back to school?
Um,
And it might apply to others in this room as well. And I have not seen any clarifying guidance as to how that court ruling reinstated the NGIB for those like me who had to wait.
It's like me, he's in the same boat as I am. And the last I got is that it got, I think it was a Marine that filed it. And I heard that,
the Supreme Court ruled
that we get it.
yes.
That's
But
my,
I haven't seen, what I'm looking for is, and there may be other people here in the room, especially those that are retired, that maybe potentially want to go back to school, who paid into NGIB, never used those benefits, but had to sign the waiver for the post 9/11 benefits, right? And
I'm going through that process. So,
so can you guys put some guidance out or finding?
I'm actually working with the Civ Ed on mine because, I'm actually going to retire again and I'm going back to school.
Right.
So I know I have the post 9/11, but I fall in the same thing as you. I haven't used my GI Bill.
Yep.
And I want to know if I want. So we're just going through that process.
And I know, and the reason I'm saying for clarification is there are some caveats. Okay, there's, did you, like, if you were on active service the whole period of time, you potentially are not eligible, right? You didn't separate from service or do this, but because in the reserves here, we are separating from active duty into combat and then back off those separation documents, those DD 14s, that ruling may apply because you're separating from forces. And if you're separating like that, it may apply. So if you guys could run that down, I'm not sure I want to go back to school. All right. I mean, but I want to make sure our retirees know that if they are subject to that NGIB, and this is if you went to school on state tuition or any of that, never used your NGIB, you paid into that program. You paid $1,200. If you didn't pay into it, you don't get it. Right? Yeah. If you paid into that program, the Supreme Court ruled that no, you paid into that benefit. You can't just arbitrarily take that benefit away, regardless of the government giving you other benefits that you may have used. Does that make sense? So if you went to school on state tuition, I used the state tuition program for my original college degree, never used my GI benefits, and I transferred my post. So I'd be interested in whether or not my NGIB was still with them.
And I think mine's a little bit different as well, because I did 12 years before I did it. I was active duty. And then it came to regard. So I do have that separation. When I came into the GI.
So can you run down, see if NGB put out any, because it's very weak at best on the VA website.
Yes,
I just typed it in there too. Again, I still can't
Yes,
figure it
sir.
out.
We don't, I'll check with NGB, but they haven't given us any guidance at all on that yet. I know that everybody who has the VA benefits, the GI Bill, about a year ago, you should have gotten an email from the VA stating that they are going to relook at everybody's claim to see if you qualify. If you do, then they will automatically reinstate it. If you don't, then they won't do it. There is a form on the VA website. If you think it's an error that you should get it, you can fill out the form and they will go back and relook at it. But I'll check with NGB to see if they have any
So
additional
on the
guidance.
VA site it shows that 9/11, it shows NGIB and it shows then they've already done that process.
Yes.
There's like a
Yes.
there's like a flow. So you answer question one, if it's a yes, or but
Yeah.
yes, for question two, yes, complete the form submit. But they're really slow voting because I requested 5 years statement 3 months ago.
Okay.
And I haven't heard anything back.
Okay. If you guys could tighten that up, because that's going
Yes,
to
sir.
affect about, a couple thousand people
Yeah.
in our force, and we should have hey, in all essence, there should be like, hey, MGIB, you may be qualified for reinstatement, and we should be doing that.
Right.
Okay.
Yes, sir.
I think was that the Rudisill? Was that the Rudisill?
Yes. Yes, that's that one.
That should be a VA form 22-1995. That's the
Okay, so I do have a question from the chat. It says, I was on active duty for 16 years. I've almost used up my entire GI Bill except for 9 days. I understand I can use the VR and E, but my question is there any time limitation to use VR and E? That's a voc rehab.
You know, I don't know the answer to that. Can they drop?
I don't think there's we'll check on that, but as far as I know, there's no time limitation. As long as you have remaining days in your GI Bill, you're eligible to use it. If you don't have it and you used your entire GI Bill, then you're no longer qualified, as far as I know.
But he's asking for about the book rehab. And
Yeah.
That's a VA question.
Yeah.
That's not a civ ed because he's gonna use, if he's done using his GI Bill, then he has to now go and get his benefits from the VA.
Right.
Then that's when he would ask about his book rehab. And I know they do have, once you enroll in it and you start your book rehab, you do have time periods. So that's a VA question he would have.
I believe is when can he use it or is there a time limitation? But yeah, we'll check that.
So I'm thinking he's trying to use a book rehab and then do everything together.
Yeah, I don't know. That can be done exactly. So, if you could, yeah, drop that, yeah, that's it. Well.
So, so the biggest takeaway I want everybody to know today is TEB, because we've gotten a lot of issues with TEB lately. If you haven't already transferred your benefits and you want to do it, you need to do it today because you have to agree to 4 additional years. If you agree to 4 additional years, and let's say you want to retire in 2 years and you submit your retirement, then when your dependents go back to use that, they're not going to be able to use it because you haven't completed your 4 years. So the big takeaway is if you haven't transferred anything, you want to transfer at least a month, a few days. Is it a few days? Is it just a few days or just a month?
I just do that.
Yeah, a month or so to your dependents. And then that starts your 4 years. As soon as you make that transfer and it gets accepted and approved, it starts your 4 years from that date that TEB is approved. So if you don't serve that additional 4 years after the approval date of TEB and you get out, even if it's a retirement, they're still going to recoup that. They won't transfer that. So that's the biggest takeaway. Just make sure you make that transfer.
IRR.
IRR is not a drilling step.
Yeah.
So you understand when you go to IRR, it's another question that's asked when you guys retire is I get questions, can I go to the IRR and do I get points? Of course you get membership points, but you're not in drilling status. The only way you can get points for IRR is if you request through HRC IRR to go on board. Then your retirement changes because you get those points. So say if you're IRR and your business says, hey, you could take leave for a month and you want to get on orders, call IRR, they'll say, yes, here you go. Now those days that you were on orders count towards retirement pay. So just because you're an IRR doesn't mean with that, I believe what's being put out, like, oh, if I go to the IRR, I'm gonna get points. Yet you are, but they're only membership points, but they don't count towards retirement pay. You would actually have to request to get on orders or to drill while you're an IRR, and they're the approving authority is the IRR HRC. Okay. So 1405 is different. 1405 is only for your active duty guys. So if you're AGR, you get 1405. Okay, because it's totally different. So why AGRs have their retirement seminar and we have ours, because 1405 only applies for those that are getting a 20-year active duty retirement. And all that it's doing is calculating your, for every day that you drilled, up to 360 points is 1 extra year for pay. So that's how it's broken down. Any other questions? Okay. Okay, all right. Next, I believe, our PFG. Yeah. Yeah.
Before I start, everybody wants to get candy. pass it on.
Okay.
Okay, good.
I'll go through.
Hi, everyone. Hi. I'm Veena Rathi, and I'm the Personal Financial Counselor in the building. I sit here in the office with all these beautiful people, my colleagues, and I'm here to talk about retirement. It's a subject that is very important. At the same time, we must all know about what's involved in retirement. Though it sounds good, like we're gonna retire, we probably won't have a job, 8 to 5 to go to, right? But what happens is there's so many moving parts in this equation, and I'm here to talk about it. And I was actually contracted by the Department of Defense, and I work for Magellan Federal. So our goal is to make sure we provide information, resources, tools, and our partnership to make sure that people understand as they make decisions, the pros and cons of making decisions. So we'll just go through this slide, and it's long, I make it short as possible. And I really encourage participation within. So the agenda is fundamentals of saving and investing, account types and financial goals, planning for retirement, and military retirement plans. And I know most of you are aware of the subject. Perhaps there's one or two takeaways or best practices you can share with each other. So there's a little activity, and I'd love all of you to participate in this. What would you do with an extra $50 per week? If you had an extra $50 per week, what would you choose to do with it? Yeah, it depends. Everybody's different. So this exercise says there may be some wealthy people in this building. They probably have a large inheritance sitting in the bank. We don't know, right? Every situation is different. And we're not here to assume. So the scenario is somebody's at a casino, right? Tell us a little bit more. Yeah.
IUL.
Absolutely. Invested well. It comes to a stage in your life where you know where you're at. So we probably all should know what our net worth is, right? If we are in this room and we want to retire, don't we, or aren't we supposed to know what our net worth is? So if you know that you probably have $2 million in the bank, then maybe that $50 can go to the casino. However, if you still feel like I still don't have enough to retire, then what do? Where does the 50 go? To your point, sir, yes, invest it into things that will build you the wealth, right? So anybody wants to share maybe a funny story where would they put the $50? Invest it, great, save it. Now the whole scenario is to understand how money grows, right? Even if you put $10 away every paycheck, over time the money grows. So that's the whole exercise, just to get us thinking about how money can grow, right? Next. So saving versus investing. Can someone tell me the difference between the two? It's already there, right? So saving is accumulating money in an account that has little or no risk of losing value. For example, what are some examples? Yeah, simple bank account, a simple savings account. You can liquidate the money like today, you transfer it or get it out of the ATM, right? That's saving. However, investing is what? We put money into things like what? There you go. What else? Yeah, that's all. Yeah, investing money into your Roth IRA, into
PSP, somebody said something? Yeah, you investing money, what about into real estate and things like that? Those are investments. So they increase in value over time. Those are investments. Even crypto is an investment. And you just have to be careful when you watch it, right? It can grow and it depends on the risk. How aggressively you can take those risks, or you want to be conservative, or you can afford to take those. So that's the difference. Okay. All right. Types of savings accounts. Savings deposit accounts. These are just simple accounts. They may not be earning you anything. It's sitting in a savings account. Normally, what do you see in terms of interest? A penny or so, right? That's a simple savings deposit account. Money market accounts. These days you may hear things like performance savings, high yield savings. These are accounts that will make you a little bit more money. So you have to pick and choose which are those accounts. So you can go to websites like supermoney.com, and then you just type Google best savings accounts. You should see things like American Express. You would see other accounts with like a interest rate of 3.6, 2.7, something before. And that's what is called the yield. APY means yield. Annual yields, right? So those are money market accounts. So for example, if you have maybe 10,000 sitting in a savings account and it's making you nothing, what do? Move it into a performance savings. And just so you know, let me ask you this question. How much of our money is protected in a savings account? 250,000 is protected. So never be afraid to move it around, explore and move the money around. It's FDIC protected. And then CDs, certificate of deposits. A CD is typically, it's like an instrument that's great for people who have money sitting, in an account making nothing, and they have no plans of using it, right? So you have no plans. You're like, for the next 5 years, I don't need this 100,000. Yet I hate to lose that 100,000. So I want to put it somewhere where it's still safe. However, it's still making money. So it could be 4% over 12 months or the longer the term. Remember, there's going to be a term. And if you break the term, there will be a penalty. And the penalty is typically a certain amount that's taken off your interest. And I forgot to tell you, I'm a former banker, so you did all this math in the bank, right? So we had to calculate CDs and everything else. However, CD is something that you can liquidate very quickly. It's not like a TSP, you're going to apply for a loan or something and it's going to take 2 weeks. It's very quick to liquidate CDs. These days, it's really quick. So, and they may pay more money because now the bank wants to hold this money and invest it somewhere else. That's what the banks do. They just take your money, they invest it. It's the same with mortgage interest rates. What are they doing? They're selling those mortgages. You get a mortgage in 6 months, what happens? Somebody else is buying it, right? So that's just the way of making money. Any questions? Differences between savings and performance savings or high yield? So we'll move to the next one. Yeah. Okay, so compound interest. What is compound interest? It's something that's building up. It's compounding, right? As it sounds. So for example, you put $100 and it's making 10%. How much is it making? So yeah, so $100, $10, then that money becomes 110, and now it's earning 10%. What happened? It's growing. So that's compounding. Inflation. This is huge
Because through experience, I find that some people who are already retired came back and had to go to work. Why? Because the money that was worth $1 is now worth how much? Like half of it, right? So for example, I'll give you an example. The price of eggs 5 years ago, how much was it? Costco, a dozen of eggs, how much? And now, how much is it? It's double. Some things have doubled while our wage hasn't doubled. So that's where the inflation, if we're going to retire, some people are like, okay, what is the net worth? And then it's all going to be dependent on what the quality of life will look like. What would you be doing with your retirement? First of all, you'll have all your fixed income. So for military, right, you'll have your pension. And then maybe you want to prolong your Social Security, but that's pension money, that's the fixed money you have, your spouse's income. And then what happens to your expenses, your fixed expenses? Is the mortgage going to be paid off? Now, if the mortgage is paid off, that's great. What will not change? The more, what changes? Sorry, maybe I rephrased it. So, what will change with the mortgage? You still have to pay what? Property taxes, and those things are continuing to go up. I just took property taxes, they come due November 10th, but you have till the 10th of December to pay, just so you all know. There's no penalty if you pay before December 10th. I looked at my statement and I saw there were assessments done, Melrose assessments for school. And somebody just shared with me out there, one of the soldiers, and said that the property taxes are going up because of it. So even if your mortgage is paid off, that will go up. And they could do some assessments too. So that's just the inflation, the cost and the price of goods are going up. So we have to be careful. We have to add that math into the equation. Inflation rate, 10% or however, So equities, again, your shares in different things, right? Your equity, there's house, or you have some shares, they've grown. Again, things can, like value, they can drop. Whatever's invested in the stock market can drop. A soldier just said to me, my TSP went down. Should I change it? I'm like, please don't touch it right now, because it's dependent on a lot of things. Number one, uncertainty. When there's uncertainty, people start pulling their money out. And so the interest rates go down, or stock market will suffer. Cryptocurrency, I'll give an example because I love crypto myself, went down to below 100,000 Bitcoin. It's a lot of fear in the market. They say bad news in the economy is bad news for our stocks, bad news for our retirement.
Look into IUL.
So IUL is another product. There's pros and cons. There's hidden things. And people will not tell you the details. So every person has to look at a product and say, is it okay for me? Because no one size fits all, right? Depends again on your age and your risk tolerance. Bonds. Who here has invested in bonds? I'm not a fan of bonds. Does anyone invest in bonds? No? It's like, it's something that you become a shareholder and then there's a face value, and then when you sell it, right, it's over a certain period of time. But it's really, it's actually something that's a good investment because the bonds dictate the stock market. All right, so next one. Mutual funds. These are, again, there's things that are invested in the stock market, just so you know. When you are investing things in the stock market, you're taking a risk. And if, like we say, at this age, we can't afford to take aggressive risks because we won't be able to recoup if the market is down. So that's why they say CDs, Performance savings, those are the accounts. They make you some, but at least they're there. You won't lose the principal balance. Dollar cost averaging, I just shared that scenario with the eggs, right? $1 today is not going to be worth the same dollar in 5, 10 years. They always say in 20 years, things double up. Right now, it's doubling up at a higher rate. We were lucky to have had good interest rates, mortgage rates, which were in the twos. Forget it now, right? It's like 6%, still sitting very stagnant. And then diversification, we encourage that you don't put all your eggs in one basket. Try to research the product first. I will encourage everyone, understand the product before you invest in it. Don't listen to everybody else. Soldiers will come and say, they said to invest in this product. I'm like, no, does that suit you? You have to look at the pros and cons. So diversifying, the example would be, you have real estate, you have a CD, you have TSP or the legacy or BRS plan. What else? What else have people invested in? 529 plans, right? Kids education plans, the custodial accounts, kids accounts, and what else? Can anyone think of anything else they investing in? Real estate, that includes investment properties. A lot of people are investing in properties, even globally. Depends on how much information they have. Soldiers who traveled, they've traveled in employment, traveled overseas, they've invested in different places. And gold, that's what. Gold is up. I was told from a very young age, we came from the culture where invest in gold. And till today, I'm like, yeah, they were right because the gold prices keep going up. And if something is an asset you can sell, it's a tangible asset. You can wear it and then you can also sell. Next, Lisa. Can someone read that, please?
Who understands it earns it. Who doesn't pays it.
Is that true? Compound interest is the eighth wonder of the world. He who understands it earns it. He who doesn't pays it. That's true. We all paying a lot of interest to borrow money. They always say, what's the cost to borrow money? People will come and tell me, I want to refinance a house. And I'm like, why? And they're like, well, the interest rate. No, because I want some cash out. How much do you want? And they're like, 50,000. What's your current rate? 2%. And what's, current, and now 6%. So we'll do those numbers and it doesn't make sense. It's a cost to refinance. It's like what? 6,000 to 10,000. And then there's a break-even point. How long will it take for you to cover the closing costs? It may sound good, it's zero, right? And the lender will say there's zero out of pocket, but it's coming out of pocket because we're increasing the interest rate. Nothing's free in lending. The banks don't give nothing for free. They'll give us interest like this much. And just do the math for a 30-year mortgage, you're going to pay double the house that you purchased for. It's more than double. So that's just the same. So there's an example there, 6% interest rate versus the 8%, and compounding annually, that makes a huge difference. And in here we have a scenario, and I shared this because this was shared with us in the class. They said we work 8 hours. How about everybody saves 1 hour of their pay every day? And I had a class last week and I had the soldiers do the math. We divided their, to work out the hourly rate, And it was a lot, just 1 hour of your pay. The rest you can spend it. 1 hour of your pay every day, if you just saved it, even between now and when you plan to retire, there's a huge difference. So people are like, oh, really? That's 1 hour of our pay, and you times 5 days, and then you times 20 days in the month. Right? And yearly, if you want to know how many hours are in a normal year, I think it's 2,080 hours. So you want to divide anything by the hours yearly, I think it's 2,080. So if your net income is 56,000 divided by 208 to get the hour. All right, so next picture. Again, there's the graph that shows how money grows. This is also the same for mortgages. In the first few years of a mortgage, the first 5 years, you just typically pay what? The interest. And then the next 10, it goes down very slowly. And if you look at your mortgage statement, you will see the cost of borrowing money. Next picture. Problem. All right, so again, inflation, so the investments we talked about, that stocks, bonds, investment funds, and there's a lot. You dig deeper, you will look at S&P 500, right? There's all these different stocks or equities that money is invested into. Now, in order for you to say which one do I invest in, you have to research each of the products to see how they did in the last year, in the last 5 years. So you have to do a lot of research. Stocks, again, there's we just talked about it, but it's no money guarantee the risk. They can lose some or all investment. Investment is not insured. And you can sell it at any time. Rate of return potential to sell stock for a profit, and dividends depends on company performance again. Like I said, research the company. Right? And then the bonds, I said I did have a lot of, like I haven't purchased the bonds. Low risk, they are backed by the tax authority, corporate bonds, riskier than government bonds. And then you can sell bonds before the maturity date, US savings bonds, and the series visit the website. Rate of return, original purchase amount plus interest. It's like that compound interest, like a seed. And bonds tend to pay a higher interest rate than government bonds. Okay. Again, going to risk and the rate of return. Typically, when the rate of return is higher, the risk is higher as well. So there's a huge tax question when it comes to retirement as well, right? There are a lot of things attached to investment accounts. There's a tax treatment for contributions and earnings, example, military TSP or civilian 401k. And what age can you draw it without tax? It's 70, right? Is it? I think it's 70, if I'm not wrong. But if you drew money before that, what happens? Yes, and at what age is there no penalty? The penalty for it's 59 and a half, so you know. So 59 and a half, the 10% penalty is not there, just so you guys know. But for example, if you said, I need 100,000, I'm going to pull it out of my 401k, right? That 100,000 now becomes taxable income. So if your W-2 is 100,000, what happens now? It's doubled. So now you're going to fall in a higher tax bracket. So the taxes, remember that there's nothing unless, and then there's like things like the soldier called me and he said, I have IRA funds, Roth, right? And I want to draw some. No, he's not. He's 59 and a half. So yeah, the 10% penalty is waived. However, the money he's gonna draw is not going to be tax-free. So unless he wants to buy a house, there's a certain amount that's allocated for home fund. And that's based on your own GSV, right? Your own retirement account. And there's a law when it goes to taxes, when it goes to the inheritance taxes, it's all different. California has a different way of doing taxes. Say you earn some money from a different state, there's so much that goes into that. All right, any questions? Yes.
I do have a question. It might be common sense for most people. do. So if I decided to invest in, like, let's say an individual company for the S&P or whatever,
Yeah.
And I buy shares, and let's say I bought it pretty high,
Right.
but then depreciate. Okay, I know I will lose money and everything like that, but at the end of the day, I still own those shares. Right?
Yeah, you can, the shares, yes, it depends, like the principal, right? Whatever you invested, you could lose the whole thing.
So would I lose those shares or would I keep those shares? And then with the so what I'm asking, so if I buy shares, right,
Right.
and it appreciates and I lose the principal, but if those shares were to go back up, do I gain on that, or is it a complete loss?
It's a complete loss from my understanding.
So when he's talking about, so if he buys shares.
Right.
And he's holding on to them, he doesn't sell them, he doesn't do anything. Because he's doing long term.
Right,
But yes, they're gonna go up and down until
Right.
you decide, I'm gonna get rid of these shares. So if you're on the down portion, then yes, you lost everything because your shares aren't worth what you paid for them.
Right.
But if you wait and you're doing long-term vesting, and they're gonna go, it's like a roller coaster, it's gonna go up and down with the market. Eventually, when you're up at the high end, that's when you want to sell it, because then you've actually made a profit. So you're not ever, you don't ever lose your shares, okay, because they still belong to you. You paid for them.
Yeah.
The only time you lose out is if you get rid of those shares and
Right.
it's below, because then you lost out on money.
Is the question the principal or the shares that you bought?
He's
Yes,
talking about the
it's
shares itself.
Okay. Yeah, so those shares, I think it's a good question, right? Those shares will fluctuate. Does anybody have some experience here? Well,
Let's say you bought one share of something,
right,
for
yes.
$1.
Yes, yes.
And then next month, the value of that share goes down to 0.01 of a cent.
Yes.
So you basically are making nothing, you still own that one share. So let's say the next month, for whatever reason, the value
Yes.
of that one share goes up to $5. Well, that you own that one share. You have
So
$5.
it'll be in the negative. However, if you leave it there, right, it's gonna grow based on how the market's doing. So you show a negative growth though, right? It's gonna show a negative. So say for example, you just did one now, I wanna get rid of it. Then there's nothing. That's it. See what we're saying? Say, for example, I invested in an Apple stock.
Yeah.
And tomorrow it tanked and I'm like, I don't want to have to do anything with this. Then you lost it.
Yeah, keep it, it goes back up.
Yes, if you keep it, then you'll have to watch it grow or whatever. But technically, today, if I wanted to say I have nothing to do with it, then I'm done. I have nothing. We answer the question? All right, so next one. So your financial goals and account considerations, again, this is very critical to retirement. Short-term goals, you're going to be like, this is my net worth, what is my goal now? Everybody has a different situation in this room, right? Some may have a larger emergency fund or all types of funds, like vacation, or you manage your money well. But there may be others, we have kids, we were educating them, right? Or we were helping family members. We may not have an emergency fund. So what happens now? What would our short-term goal be? The short-term between, say, 1 year goals. Even before 2 years before you retire, that emergency, do I pay off the car or I need to buy another car in retirement? That they need something. Or long-term goals like, will I be working another job, right? If you're working another civilian job, you will have another retirement plan. And that can be a backup. So it depends where you are, what age, and how many more years you want to work or not work. It depends on your situation. But like I said, if you have a lot of inheritance, you have many assets, you may be thinking about, you know what, I want to travel, I want to put all my things in storage. And for 2 years, I won't have rent. I've had scenarios, people came and said, now I'm going to travel, I'm putting all my things in the storage now. What are they saving on? The rent or mortgage, right? Or they rent their house out. There's so many different scenarios. So that's where retirement planning comes into play with all those things. Going back to school, Mr. Lopez said he's thinking of going back to school. You never know. Later in life, people will have some purpose. They're like, okay, I want to be a teacher or chaplain. Just so you guys know, you guys can also be accredited financial counselors, like what I'm teaching. If you're interested in finances, it's something you can do. They actually send out an email saying, please push this to the soldiers, and they can do this too. So, you know, it's something you may want to do, teach, because they have vacancies at different bases like Beale and other Air Force bases, military bases too. All right, so next one, sir. All right, so this is just a fun activity. People have vision boards, right? Building your retirement vision. So everybody needs to talk about money. It's something you can't push in the back burner and say, you know what? I'm planning to retire, but you don't know where you're at. You don't know where your assets come from. You don't know how much debt you have to pay. Insurance, talked about that. Pension is great. For those of you who have pension, that is beautiful because that's a fixed income you get every month. Your children, a lot goes back to how old are they, what will they need, housing. These days, kids stay with their parents longer, and they do maybe think about creative things like pay us some rent, right? Their kids, I have one child, and I had her pay me $500. She paid me, and I bought her house. So at 26, she was a homeowner. So I played, I'm like, I'm a finance person, I'm going to do this, right? And she moved out, and she's good now. She can take care of her stuff, but she's always, they'll come back to you for help. You should never lose that part. So think about this. What's one area of finances that you feel like you need some help with? Whether it's debt. How do I pay off the debts in 2 years? Goal setting and SMART goals, that would be helpful. Also, maybe a spouse wasn't working, now she wants to go back to work, right? Their spouse was in stay home, they taking care of the child. Now another spouse is retiring, so she goes and starts building her career. There's no, people can do whatever they want. So think about this as your plan. And take this away as something where I need to understand this, and going back to what I said, look at your net worth. If you go to this website, it's called FINRED, FINRED, type net worth tracker. There's a tracker, you can fill it out and you see your net worth. And it'll show you real numbers. Also, someone had a question about the GI Bill. I'm going to give you guys a website, My Army Benefits. And under that, My Army Benefits, under components, you just click if you are a guard, right? Yeah, so guard or your active duty, pull down, click on that. It takes you through all the benefits A to Z. And the GI Bill is explained in depth as well. And there's a library too. You can just type search whatever you're looking for. The employers' retirement plans, contributions, withdrawals, and portability. So we'll look at that. Yeah, so next slide, we'll see the examples. So the traditional, you guys know the TSP, right? The TSP before when people joined before 2018, what was the TSP called? The legacy, right? So if you joined before 2018, you will have the legacy old, I think it was on 36. They had another chapter.
Item 3. Item 3.
Yes, there. And now, tax treatment, pre-tax, we talked about the 59.5. Early withdrawal penalty before 59.5, with possible tax consequences. We talked about that. So, for example, if you put money in your TSP, what they mean by pre-tax is they'll take your gross income minus what you're putting into your TSP, for example, 5. They take the money out and then you get taxed. And the Roth is tax upfront. All right, so we move on.
I thought you were saying that Roth was pre-tax. Oh, like that's wrong.
No, yeah. It is right there. So Roth, whenever you put money into Roth, they already take your taxes. So see the difference? Pre-tax on the traditional, after-tax contribution on the Roth. Again, the Roth has a cap, right? There's a cap of 8,000, and then the catch-up contribution is over 50. Does it make sense now? Is it clear? So TSP, again, the withdrawals. Lost it?
Yeah.
It's okay. Look at the BRS plans, these plans went into effect in 2018. All right, so
Next slide.
yeah. So in the TSP funds, there's all these different funds that you can invest in, and it's all dependent on your agency, right? So whether it's gonna be conservative or aggressive, and if you need more information, I do have a guide and I can send it to you on the explanation. Next slide. Everybody knows how to look at their TSP? And another thing is make sure that your beneficiaries are updated. It's really important. Manage your beneficiaries, you update your legal documents, whether you have a will or trust. I'm just going to touch on this one. Looking at that. And TSP.gov, sometimes it does give you, like it'll tell you to put in your home address, and then they'll mail, they've been very cautious, I think. Especially when you're changing addresses and stuff like that. All right, next. Annual contributions, I think the next slide will tell you, so can you go to the next one? All right, so here's the sources of retirement income. Social Security. Again, Social Security is something you want to make sure you understand. SSA.gov. You can create an account and you can see exactly what the payout will be if you were to retire. And with the Social Security, remember that they only have survivor benefits. So if something were to happen to anybody and they have children minus, money will be paid to the minors till they are 18 or going to college, but there's no lump sum. The only lump sum they get is $250 when there's a death. We just dealt with a spouse who said she received the $250, lost a young husband. Social Security will pay the kids till they are 18 or going to college. And that amount is based on the earnings of the person. And some people don't know that the kids are entitled to the social security benefits. So make sure that people understand that your pension plans, you may have had an old plan from an old job that you had, you forgot about it. There's a soldier who said, I worked somewhere when I was 18 to 20 some. He forgot and then they researched and they found the money. So make sure you find out what you have. They see it there in an account low number. And then your savings and investment income, if you're invested in real estate, rental income, and things like that. You want to make sure you understand all that. So you can live well in retirement, right? Next. So we already discussed it, see, the blended retirement, the VRS, and the legacy. The main difference is the matching contribution. Even if you retire, try to max out this contribution. They match up to how much? 5%. So try to, and there's the explanation. So the VRS is how we have a lump sum option, continuation pay. And these are the things that changed with the VRS. And why they changed it is a large percentage of soldiers left and they didn't take their retirement plan, so they changed it so they have options. Then the old system paid a little higher, right? 2.5, and that's the we talk about the survivor benefit, even survivor benefit veterans administration, the VA has life insurance, so you have to contact VA immediately. Make sure your family members know everything. Update on your records of your finances, right? So they know. At this age, I think it's important for us to understand that everything needs to be told to someone. That's pretty much it. We are here to help, and we are here. I'm here right here in the building Monday through Friday. I go to Okinawa and I'm presenting, and I'm available to all of you to reach me. Your family members are available. It's no cost to anybody. We are here to help and guide you. And so the conclusion again, saving and investing, we have to be really, really careful about how we invest our money. We just talked about the Apple stock, right? If we invested and we lost it, we have to wait for recoup. And if we can't wait, then what? We lost it. So pretty much that's it. Any other questions or any comments or any words of wisdom for anybody in the room, like retiring? There's a lot when it comes to finances. So you can make an appointment with me. We can look at your numbers. I can analyze it for you and show you like, yeah, this is this. And when are you retiring? What's your life gonna look like? Are we gonna be modest or are we gonna be, spending a lot of money? But at that between now and maybe 10 years, what do you want to do? And I tell people, don't wait till you are 70 or so and you want to travel. By then, you may have a broken back or something happens. You can't even go on the plane, right?
That's definitely. It's really, so when we used to have the retirement seminars, even when I retired, we never had a financial planner. It's always been hard to get them, but they're very important. A lot of the information that she gave when I retired, I didn't have. Luckily, I was debt-free and everything already before I retired because I didn't plan correctly. But not everybody gets that. So, and I do see service members, especially when they do retire, and I'm doing their retirement pay because in actuality, traditional Guard members, their retirement is a supplemental retirement. It's not an actual real retirement. But now that the garden's changed, you guys are involved so much, you're on orders, you're getting more points. It actually turns out to a pretty good retirement. You're talking like $2,000-$3,000 for a retirement. I mean, some other people are a little bit higher, but but it is. And it's good to have a PSC and be able to plan your retirement. So when you do retire, you don't have to get another job.
Yeah. And even just to conclude, if you're in a situation like when it comes to counseling, there's 3 types of counseling. One is the remedy situation. We have soldiers who come and say, I messed up, right? There are things that happen, life happens. There's a remedy, we intervene and we say, this is what you need to do. Then there's the preventative ones. There's some that may say, you know what, we didn't make good financial decisions. How do we pay debts? How do we improve credit? How do we buy a house? Then we can help with. And then the productive ones, they come to me and say, I want to be a millionaire. Teach me how to make more money. Bitcoin or whatever it is, we'll take some risks, but I show them what to do and they can choose. So we do all those types of counseling and you guys have us and our heart is in the business. I love what I do. I'm passionate about what I teach. I just want everyone to be comfortable and have a comfortable life, not to be wealthy, but have a great life where you are not like, I'm broke, I can't buy this or that. In retirement, we all want to do what we want to do, right?
Most definitely.
So thank you. That's what I want for everybody. And I hope you took away something today and you guys have access to me. My phone number, I'm going to give it out. 916-207-9730. 916-207-9730. My name is Vina with a V. And then, yeah, Vina and yeah, 916-207-9730. That's it. Thank you very much.
Okay, so we can take a 10-minute break, or if you guys want to go on lunch, you can go on lunch and we can finish up. If you do the 10-minute break, come back. I'm the last speaker. We're going to be going over how to read your DA 5016, and then I'll answer any other questions that you guys have concerning RCSBP, CRDP, CRCS, whatever questions you guys have, that'll be open for you guys to ask. So would you guys like to take a 10-minute break, or you guys want to go to lunch and then come back and we finish up? 10-minute break? Okay. 10-minute break. good year. Obviously, if you're drilling and you do not show up to drills and you don't have 50 points, you do not have a good year. You'll see it, it'll give you your points on the side as you keep going through it, but it'll show you the D16 where to look at. Go ahead, Nelson. So this is how your AYE works. So you started in 2018, September 20th. Your AYE would start the 19th. So you mean 09 and 19. That would end, and obviously the September 20th, your AYE would open back up and then close on the 19th. So that's how the AYE works. Okay. And the only time the AYE changes is if you have any breaks. So service break, transfers, RFC, non-SOP, then your AYE would change. Fixed. Okay, how to read your D85016. This is everybody has this in front of them. So I just put this up there just to show you. The portion, I apologize, I'm not going over because I'm still, the D85016 is still new and I'm still trying to read stuff on it. So in the bottom part, the reason code where it has X, S, N, I, U, and K, those would be on the far right. And it gives you, so X is you exceeded your drill points. And then the NK, so that on the legend, it tells you, we're all, to let everybody know that the D85016 is new to us too, as it is to you. So we're trying to do our best to get caught up and understand it, which I think we almost do. But we just want all you guys to bear with us. Go ahead and go to the next slide. So if you're looking at D85016, it has your BSAD date. So remember, if you're a true Guard member and you don't have any deployments, you're not going to have a BSAD. It's not going to be on. Because basic training won't count as a BSAD. Any deployments though. So if you're a true Guard member and you want a deployment, you will have a BSAD. If you're a true Guard member, you never deployed, never did anything like that, you're not going to have a BSAD. Okay. You should have one. And right now, if say some of you guys are showing it that have deployed and some of you aren't. And we don't. Yeah, I've seen that on a number of people that have done requests for corrections. And like I said, it's IPSA, we're still trying to learn. You should have a BSAD date. It should start the day that you went on your first active duty. Then it breaks down for every time you have a break, it'll fix. So go ahead. Yeah, so that's what we haven't really addressed yet with our S1s and everything like that. Because now we're starting to find out that a lot of people aren't having BSAD dates on their D85016. I don't know if it's like so RPAM, it always shows up. The D85016s, it looks like that if you're not currently on an active duty or whatever, it's not going to show a BSAD date, and we don't know why.
If you haven't been coded as an active,
It'll come off, as in RPAM stood on there.
and you drop your DASD.
Yes.
I understand for basic active
Service date, yes.
That's every time they have a breaking it.
Absolutely. But what I'm trying to tell you is that just for the NGB 23, they always have it on. So if you started, the D85016 does not do that. So we get a lot of people asking questions about that.
That's already something that NGB is aware of. We know, like, if you're an M-Day soldier, whether you have active duty service time or not, it's not going to reflect in the 5016, whereas he stated in the NGB 23, it does. Now, if you're not on an active duty status, it won't show up. We brought that up with NGB. They're looking to doing a fix for the National Guard side. I don't think the reserve had this issue. They've already been in IPSA with 5016 for the last few years. And this is something we just brought up with them. So they're going to look into it to see how we can fix it. But for right now, if you're not on any type of active duty status, you won't see a BSAD. Yep.
But we're just making you aware of that. We know that you probably had a deployment and you do have a BSAD, but the 5016 is not. And a lot of these issues that we're having, they are being sent to NGB. Yes.
So what are membership points? Are they good for anyone?
Yeah, so membership points are good for traditional Guard members. So when you complete an AYE, it gives you 15 points towards pay.
Oh,
So, and then when you do retire, if you retire before your AYE date, your points, the membership points will be prorated. There's an actual chart for every so many days. I believe it's 13 days, you earn 1 point. And then so on and so forth. 36 is 2 points. And it goes all the way to 365 points to give you your full 15 membership points. You'll see where your current AYE date is. And then where it says date, ESC eligible retirement, that's when you received your NOE. The NOE is your notice of eligibility, also known as your 20-year letter. So if you've already received it, the date, that should be the day that you hit 20 years. And then the far next corner is your high. That's going to be your high 3. And I've noticed on the DA5016s, once you get promoted, it automatically puts that as your highest rank. So that's why when we submit you guys' packets, promotion orders go with your retirement packets to HRC. So they know how long you've been, whatever rank. Yes. It should not be blank. Yours is blank.
Well, it's not gonna switch high 3 until you go 3 years time, right?
Yeah, so I've been noticing we're having a lot of issues. So, and this is why I'm saying there's such a big difference between the NGB 23 that you should have in your iPerms, your last one, and your DA 5016. The NGB 23 had so much more information and it kept it current. So we could go on there as RSOs or RPAM managers and automatically I can identify a correction that I needed to do. It's not that way with ISO. So in the DA 5016.
So we did also address that question, sir. Multiple other states have asked that. There's a Teams channel with NGB with all the issues in the high 3. It has been brought up a few times already.
Show until you hit time greater than.
Yeah,
It's supposed to, and that and NGB 23 does that, and RPAM does that, but in IPSA doesn't. On yours?
Mine says 07.
Yeah. Yeah,
And
we're
that's what it should. There's a line. Yeah. So like if you were E6, so what they're saying, it would be like an E6 and then say he was an E7 and he had 1 more year.
Yeah.
It should still say E6 until he hits high 3 with E7. But some of the people they don't have anything in
yes,
there.
yeah, that's what
So
we're
that
addressing.
is
That's the problem.
And that's the problem we're addressing. And just so that so they are all going to NGB, all these things that are coming up that are messed up. Yes, sir.
if you do issues like you just stated, they are paid.
So it would if I was turning in your packet now, but we would put orders with it because high 3 is very important unless you're BRS, but BRS also high 3 counts as well. Do we have any BRS or everybody legacy? I love legacy. It's so much easier. So right here is what I have.
We had a question over here.
Sure. AYE. That's your AYE, your end date. So that's when you came in.
That's the day before you enlisted or came into the guard or officer.
And that determines your good year.
Yes.
Yes.
Not a fiscal year. Not a fiscal year or a military year. Or everybody's a little bit different. So
exactly.
And why that should be smart is if you're planning on retiring, you need to know what that is, and so that you could you may
claim better.
You may want to ensure that you have 50 points because it's not a fiscal year. Does that make sense?
Yes, sir. It is long.
Yes.
Okay.
So it's your current AYE. So if you had a break in service or whatever anything that happened, it changed. So in RPAM, and this is why I keep going back to the NGB 23 because I know everybody has a bunch of questions because it's a lot different. Your NGB 23, your AYE, it actually gave you breaks because it had a MIMSI code and it showed you all your different breaks and all how your MIMSI or how your AYE changed. But it's still up at the top of your current AYE. As that one, it's going to change. And that's what we're saying is all these questions you guys are asking that you think that are We've already brought them up to NGP.
If you, ma'am, if you think that's incorrect,
You let
just submit it through your unit. They'll submit a request to our tracker and then we can do an investigation. The AYE is something we can actually go in and make a change to. The other issues we talked before is something we manually can't do.
Yes. So,
Yes.
yeah, and then back in the day, like, the AYEs on NGV 23s, we couldn't adjust those because it had to feed through IFSA. But now we can adjust it because we're all working in IFSA. So if you look at this slide now, it's going to go over the different blocks. Your start and end of your AYE. The email class, that is if you're officer or enlisted. And then it goes to service, the service types. Those replace the MIMSI code. So those are USA if you're in the United States Army, Reserves. It even has codes for Reserve Air Force. It has active Air Force. So all those would be the type of service you were in. You go IRR, it's all going to reflect. If you're on deployment, it's going to be National Guard mode. If you're AGR, it's literally going to say AGR. So those are all those codes for you guys.
You got a question?
What happens to the things that are not prohibited? But I haven't done it that's needed here. What happens to them?
So when you're looking at credible and non-credible, so if you exceeded, excuse me, it's only going to count the points for the max IDTs that you receive. So you're always going to go on the credible points and go all the way down. That's what DFAS is going to be. So they've already calculated what's exceeded, what's not. So whatever's down at the bottom is what you're going to get for your return. Okay.
And what's the point of learning?
So there's points earned and there's credible points. Credible points are for pay. Points earned, like I was explaining, you could have been on an active duty order or you went to a distance learning course that they gave you points for, but it's not for credible for pay. Those all those old NCAF courses we went to and you had to do all the prerequisites before you had to go. It's those. Yes, but now they have EDVL, which coincides with all the your guys's NCOES courses. Let's see. There are points to drill, the earned points for drill attendants. You'll see where it's all right there, inactive. Then the next block over, that's going to be for your funeral honor details. So you would know how many points you earned if you're doing that. The next one is the correspondence courses. Please look at those and just remember April 15th, 2016. That was the last time you could get your correspondence course. After that, it changed to EDBL. EDBL, it's the electronic learning distance.
Electronic based distance learning.
So now when you go to courses, they're all, you have to be paid for them. And it's whatever Big Army gives to all the reservists. Once that money's out, that's what it is. So, because we can't manually do it anymore. We can't manually put in your correspondence courses unless it's before April 15th, 2016. Then you can actually go in there and get your courses, put them in there, give you your points according to the regulation. The next one is your membership points. This is what we're talking about, the 15 days. So if you look at this one up here, as you see his drills, and he didn't finish his AYE because he had a bad year, you'll see that his membership points are really extremely low. So you look at his membership points, and you're going down and you go see how they're all 15, and then if you're not drilling or you don't, your AYEs, you're not getting a good year, you're not going to get the 15 points. So after the membership points is your active duty points. So if you're 365, it tells you for every, all your active duties. Then you have your qualifying years. This is a big bracket. It has years, months, and days. So you just look at those, make sure all those years are good and qualifying. So if you look at the one where it has red, where it has a bad year, and you go on to qualifying, he's at 0 all across the board because he did 0. No, he's not. And that's why he only has 14 points.
Pretty much, if you have a good year, you should see a 1
Yes.
under years.
It would be under your qualifying retirement. It'll give you your years. And then you go to the bottom. It'll give you your total points and then go to the next slide. Go ahead. So this is how you're gonna recover. So and when you guys are done, when you guys are looking at your DA 5016, at the very bottom, it's gonna give you your total years of how many you have, years, months, and days. So the AWOL guys, yeah, they're not gonna make it.
Well, the National Guard, retirement after 20. All, I mean, there's really no difference.
Basically, no, majority of 20, it's what you want to give to the military, I think, because once you get 20 years, you're eligible to retire. Now it's your personal goals of what you want that National Guard retirement to be. Do I want to go on orders more? Do I want to do this? Or do I just want to retire?
Based on points.
Yeah, based on points,
Not years.
not years. So the way they figure out your retirement pay for National Guard members is, even though you have 37 years, what I'm going to do is give your total points of what you got for retirement and divide it by 365. That gives me your equivalent year of what an active duty member has. Then I use the table, the 2.5, and then that's how you get your percentage of what you're going to get for your retirement job. That makes sense. It's really hard. It's easier to do. I have a calculator, and that breaks it out. But that's what we use for our team, so they can calculate figure this stuff. Yes, ma'am. What do you mean? Like, so once you receive it, everybody.
It should be the month after you hit 20 years.
But so the reason why I'm hesitant to say so the way it used to work is that if you were 20 years in August, you would not receive your NOE until September. We have to let the year close out so we can run the report and get everybody in that month. And then within that first week, all your 20-year letters go out. It's say now, I haven't done the 20 letters.
It's still going to be the same. The only problem now is it's supposed to be automated in IPSA. We have to go in and press the button, but it's still typically supposed to be 1 month after you hit your 20 years. So if you have not hit, no, we actually have to press the button here. So our team actually presses the button. You haven't got, when did you hit 20? Okay, we're still working on September and October because we have just switched from RPAM to IPSA at the end of September.
Yeah,
and then in October, we were having a lot of issues with initiating NOEs with the 20-year letter. So typically we were in RPAM. In October, we would have already sent you your NOE if you hit 20 years in September. But because we just switched over, we're going to start getting all the NOEs out, right?
We got to figure out what they do rest yes.
Yes.
Okay,
Well, yes.
so just to let you guys in and give you a backstory real quick. So RPAM, September 17th, that's when it was read only. That's when we are like, okay, everything needs to be done. We try to get as much done as we could. Read only all the way to October 7th. October 7th, it went away. That's when all your guys and you guys started seeing your NUB 23 alpha getting put in your IPRMs prior to your AYE close date. That's because everything was switching over to this. Now we're completely indexing. So RPAM does not exist. So I'm keep talking about it because I want you guys to know that we're doing our best to correct your guys' stuff. So obviously, we're having a lot of issues, and we are bringing them up in just so you guys know.
But I would say if you don't get anything by the end of the year, then definitely get a hold of us. We're working on all the backlogs right now. We've just worked with HRS, Human Resources System, with trying to figure out how to do all the NOEs. I think we just figured it out yesterday, so we're gonna go through and we're gonna start pushing all the NOEs out. I'm sorry? When will you be out? Okay. We'll be able to get out by then?
Oh, yeah. If we get to point of contact after this, we can get it.
Yeah, yeah. Just meet with Spencer. He's our guy right now who's issuing all the 20-year letters.
Okay.
And we'll be sure we get yours out to you before.
So these are the valid documents. So when you guys are asking for corrections to be done, these are the valid documents that you can use. It's LESs and MPAs, which are pay documents, 1379, your DD-214s, DD-215s, DD-220s. So somebody was talking about I was on 90 days of orders. By regulation, you're supposed to get a DD-220, which gives you your time of when you are on that active duty order. Because obviously it's less than the 180 days for you to get a DD-214. You can also use a retirement points memo. And those are only used for like dark nights. And if you're on RMA, RMP, or doing SUDAs. And what accompanies with that would be the SUDA form that you've completed your duty and this memo. Okay, and just make sure that it's the commander it has to be your commander because he's the one that's certifying. He's on the 577 for today. Okay, and this is also for the 1379. So if you're drilling for points only, that would also get turned into us, and then we would code the end code until it should be automatic eventually in IFSA. But right now we're doing the end codes if you're not drilling, if you're only drilling for points. So if you're trying to figure out your M day, so it's your total points for retirement divided by 360. Yes, that's going to give you your equivalent years of service you have, and that's what you're going to use for your chart. So just because you have 37 years, so if I did your math or whatever, and you came out and we got your equivalent years for active duty, it might be 11. That means you'd be at 11 years of your high 3 of whatever rank you are. And it's done by 2.5. That's how we get it. So
Points divided by 360 times 2.5.
5. And then that gives you your percentage of what you would be receiving. If we keep going on, I don't start getting confused. Let's get it. Invalid documents, orders, your W-2, bank statements, NGV 22, and red report. We've got all of them before. So those, I can't do anything with them because we can't give you your points. So those, just make sure if you're providing, if you do have your orders and you are, as long as you have a DD-214 or LESs with them, then we'll use it. But if you have your LESs, it's going to give you the dates anyway. So. This is where you recover your points. This is the DFAS website. You'll go on there and it tells you what branch of service you need to do. Once you hit that, go to the next slide. It's going to pop up this. Then once you go to the next, when you click whatever you need, it's going to bring up this self-explanatory. Go in there, put whatever you need. Most of the time, you talk to us and we're asking you to get LESs or MPAs. We'll tell you the time periods. We'll be like, oh, you have a bad year from 1994 to 97. Get this from December or January to December. So you capture all that, then it comes to us and then we'll correct your RFC. Go back. Yes. So now if you guys go on to DFAS, even if you just go on to DFAS and you go to the home page, you can get to this. It has quick links and it says recover LESs. That's another way. It just started working and I like it now because now I don't have to Google and try to go to all this, and just do that, and it goes, and it tells you what branch of service is right there, Marine Corps, Army, Air Force, Navy. Important tips, so especially for you guys, please review your DA 5016. Make sure that you have your 20-year letter. Make sure you've done your 26-5, which is the RCSBP. Make sure those are all done. Okay. When you're ready to retire, so not when you're ready to retire. When you're ready to collect the retirement pay, our office is the one that does it. I know everybody gets confused when you hear transition assistance, because when you say that on an active duty post, that's really a transition assistance place, because when you get out of the active duty, it's a one-stop shop. You go see finance, you go hear education. We're transition assistance to help get you your retirement pay. So it's a little bit different. When you're actually applying for retirement, you'll be going through your unit all the way through all your S1s up to state. It's either the EPM or OPM. They're going to do your separations. Okay. So when you guys are asking, oh, I'm getting ready to retire, you're actually not going through us. You're actually be going through either EPM or OPM separation. Okay. Go ahead. Sir, you have a no.
So when you start, when you're ready to retire, when you get an assignment to the person in phone contact, answer those, they can help you answer those.
Are you talking about for your pay or for if you're just getting ready to submit for retirement? So to go in the gray area of retirement, correct? So you're going to be working with your unit, and they should be working with you side by side all the way through your S1.
Yeah, they do.
Because it's not going to come to us.
So you do this checklist and thing,
By regulation, anybody with 18 years or more has to come to a retirement center. It's mandatory. And it's in the regulation even for active duty, everything. You have to come to a retirement seminar before you actually exit out and retire. Go ahead, Matt.
Okay, I have a question.
Go ahead.
All right.
All right, questions. So you can answer all your questions.
I went to Spencer one time and had your discussion. And I don't know if you remember this or not, but he mentioned that after 2 years of receiving your retirement, you have to do something to change.
That's the SPP election. That's
Okay,
2030.
so this is what I'm going to go over right now. RCSBP. That's a reserve component for our benefits. I don't have a slide. I'm going to build an actual slide deck for RCSBP to go over everything. So RCSBP is what you get when you hit 20 years. You're going to get your 20-year letter, and in there it's going to be the 26-5, which is your RCSBP. Only reserve components get that. You have to make an election at 20 years of your survivor benefits. There are 3 options: option A, option B, and option C. Option A is saying, hey, I don't want to participate in this SBP stuff until I retire at the age of 60. B option is like, hey, I do want to do this. I like the plan, but I don't want to start paying or get me covered until I turn the age of 60. Then you have option C, which is immediate coverage. That means if you, in all these options, option A, if you were to pass away prior to you turning 60, your family gets nothing. Option B, your family does get something, but they won't be able to collect until your husband would have turned 60 years old. So that survivor annuity would wait until that service member would have turned 60. Option C means if he passes away, you contact us, we do your survivor benefits plan, and then you get to collect immediately. With the SBP, your what you pay into it is 6.5% for your spouse. She gets 55% of your retirement. There, for the elections, the categories, you have spouse, spouse and children, children only, spouse only, former spouse, and children. You also have insurable interest. We try to stay away from that because that's the highest cost. So if somebody who's doing insurable interest and you say you select a niece or a nephew, you're 58 and they are say 12, your percentage is gonna be 40% of your retirement pay. So basically, if you're not getting that much you're not gonna get a retirement pay. It's all gonna go to the insurer one. So we try to keep people away from that, and you just run the numbers for them just to show them like, hey, this is what your premiums would be, and what they kind of do. So, and we're here for counseling. So if you already have your 20-year letter, we can answer your guys' questions, but you cannot change that until you retire. And that is at your 28th to 36th month, you're allowed to go into DFAST and say, hey, I no longer want this plan. You're not going to get any money back because it's like insurance. You were covered at that point. Once you relinquish and say, I don't want to do this, you can never participate again unless there's an open season. If an open season comes back up again, you change your mind. Just remember that time period that you said, I don't want it, they're not going to backdate anything or anything like that. It'll start when you apply for it if there's an open season. And it's rare, they usually have every 5 years. So, yes.
On that, you said there was options for, spouse and children, et cetera.
Mhm.
What if you didn't have children before you got that children, and then now you do?
So that's a good question. So when you have an RCSPP, it's a change of life. So you would just reach out to DFAST and say, hey, at the time, I did not have any kids or children. But remember, when you get your RCSPP, if you don't fill it out, it automatically goes to option C. So once you get married and you provide the birth certificate, marriage certificate, whatever you're providing, those documentation, they're automatically covered. So even if you're not married, I always tell everybody to fill out an RCSPP, just so because what if you do get married and you didn't fill out your option C, but you didn't really want it? So even if they're single, I tell them, like, if you don't want it, fill this out so you're covered, and they won't automatically give it to you because you didn't fill anything out. It's going to be suspended. You don't fill out, 2656 does not go in there. You have RCSPP, you're automatically option C. So you have 90 days from when you got your NOE. The 91st day, you automatically know that you're going to be in option C. Now, for other things like for VA and stuff like that, unless you have a question about RCSPP?
I don't know. No, I was just looking at that. I was kind of the next one down. You want to run it. I was going to ask you, if you were going to do your documents here, when they just came back.
So when you guys when you're retiring, we usually don't check your paperwork, but when you come to us to submit your packets for pay, we actually go into all your records. We make sure you have your 20-year letter. We make sure your RCSPP was filled out. We make sure you have your separation order. We go in there and get all those documents for you. So when you guys are retiring and getting paid, we do basically everything for you. We're going to fill out your 2656 for you. We're going to fill out your 108. We're going to get all your documents together. All you're going to do is review it. And we say, hey, it's good to go. You're going to sign it. We're going to sign it. And then we're going to submit it to HRC. So it's really, we're checking again. You have to. So the individual has to make it. If you're already eligible, so when you're eligible to collect, there are so many guard members that have retired. We're not allowed. I've been asked many times, well, you didn't call me. I didn't know you did 60. I didn't know you were eligible for retirement. There's nothing telling us when you're eligible to receive your pay. You will get that as long as you keep your DEERs updated. HRC will send you a postcard when you're supposed to submit for retirement. If you change, if you move and you don't update anything, HRC is going to send it to the old address, and whoever gets it probably sends it over. So that's my other things. Make sure your stuff's updated. By all means, keep in touch with the HRC when you guys get out. If you're going to move, you're going to do anything. So you do get that reminder, and they're going to remind you 9 months prior to your eligibility date. That's when we like to schedule the appointments, get everything done, submitted. So once it's submitted and it's done and it goes into HRC, it just goes into the holding matter when you're eligible to select, then they'll process it. With any other questions about RCSPP?
No.
So the next thing I wanted to talk about was concurrent time.
Sorry, what?
one other thing.
Sure.
On that subject, let's say that our 20-year letter came a while back, and I'm uncertain exactly what I checked. Can I go into it?
I promise. And your 2656-5 is in iPhone.
Okay.
And if you're really unsure and say, hey, you know what? I really think I submitted this. And maybe you were like some other service members, but I had them tell me like, hey, I'm like, it's not in your iPhone. So I remember submitting to somebody. So what I do is I can go into HRC's website and look you up to see if you submitted, because we have some people that submit their RCFP directly to HRC. They totally skip the state. So we're under the assumption that you never filled it out. So when they tell me, oh, I think I really did, I'll go into that website, look it up real quick, and sure enough, like, oh, you guys did submit it to HRC, you can get it to us. And then that's when it's covered.
The RCP thing and everything else, all of that goes away in 60, right?
Yes. So once you turn 60, that the reason the guard has RCSBP is because you have to make an election before you retire. You're making it in 20 years. If you're AGR and you do the RCSBP, you get a do-over because you're not retiring. You get it a regular activity time. So they're going to fill out the actual FBP in front of you right when you retire. So we're doing your guys is again when you retire for pay. That's what the 2656 is for. It's going to go over. We don't even have to really fill it out. All we do is check a box. Whatever you picked in your RCSBP, the 2650, you just click that box. If you picked option C, and it grays everything else out. You can't change it. They're going to go off of what you would like it at 20 years. So when we're going over your retirement pay, it explains everything. You'll see it. And you're like, oh yeah, I remember talking about RCFPP. And then you'll see what we click and you get, oh, it makes sense. Okay.
Before you go over CR, you're going over CR?
Yep.
Okay, there's some questions with what you just went over. Let's see, it says, when the soldier that finished 20 years, do they need to wait for their ETS date in order for them to retire?
If they already received their 20-year letter, then no. If they have not, and say a lot of soldiers like say, oh, I've completed 20 years because they're looking at their LES or whatever. So your LES is really not correct according to your retirement point statement. So we usually tell them just to look at that to make sure they have already received their NOE. Once you receive your NOE, man, you're golden. If you haven't and you're thinking you're trying to retire, because we have a lot of guard members that I want to retire exactly at 20 years. I haven't seen a guard member do that since I've been doing this. But the fact is, when you get your NOE and where your AYE is, all that stuff. The only ones I've seen ever get that exactly at 20 years is when they med board. So the med board will actually, if they're at 19 years or whatever, they'll put them exactly at 20 years. And then you have to jump through hoops to do all their stuff. Yes.
They don't need to wait until they receive this money, like receive the packet, or what's kind of the timeline?
So once you receive your 20-year letter, you know you have it, you can retire. You can go ahead and say you're retiring. Now, if they can't do anything. Without your 20-year letter, you can't even submit your 4187 or anything to state because you don't have your 20-year letter. So you have to have that 20-year letter to apply for retirement. So our score is like for you, you can start the process and just let them know that we are doing the 20-year letter. So when we do get your 20-year letter, it won't hold up your process for your retirement. So it's the date that the NOE was produced. So, but it takes us a week to get it out to you guys. So you're already a week behind.
Well, when in IPSA, this is how it's supposed to work in IPSA. We go and press the button. It's supposed to generate your 20-year letter. It's supposed to send it directly to your iPerms. And then whatever email, your primary email is in your IPSA. So if you haven't updated that, it's very important that you update that your email address. If it's still your MDay email address, you're not going to get a notification. If it's your personal address, you will get the notification, because a lot of MDay soldiers don't have access to their military email until they come back to drill. So if you prefer it to be your primary email address to be your personal, then you have to go into IPSA and make sure you update that. Once we press the button, it's supposed to send a notification to your email address letting you know that we generated a 20-year letter for you. It's supposed to include your 20-year letter. It's supposed to include your RCSPP election. And from that date, it's going to give you 90 days from that day when the email gets sent to you for you to make that election. If you don't make that election after 90 days, it's an automatic C option. So that's how it's supposed to work in IPSA. It's supposed to send a notification to you. It's supposed to drop that NOE in your IPERMs, and it's supposed to send a notification to your S1 pool. So that way your unit knows that you've got your notification letter. And the reason why we haven't generated it is because it's not doing that. What it's doing is it's sending a notification. It's dropping the NOE into your IPERMs, and then nobody knows about it. So that's why we have not generated that, because we didn't want anybody to miss out on the 90-day window. We want to give you enough time to make that election. So we just figured out, and we had that fixed on Friday. So we're going to go ahead and start doing that. But yes, it's supposed to send all those notifications out at the same time.
What numbers don't match? Yes, it does matter, especially if you're retiring, you're eligible to collect pay. Because now we're gonna submit. Oh, okay. What do you mean, what you report? I'm trying to understand your question.
20 years and 4 days, just like showing 20 years and 0, well, things like.
Yeah, so on RPAM, it would show you that the 20 years and whatever 4 days. Well, this one doesn't. It doesn't show you. This says the 20 years, and that's because your AYE is still open. Once your AYE closes, it's going to start prorating the rest of your time. Okay.
Okay. So question. Oh, I'm sorry.
You, excuse me? So this is another issue we're having. So a lot of units, they can't. If your packet's not sitting at up here at state, getting ready to be approved, you're not retired. Have them show you that it's been processed and that you have a retire reserve order pending. Because if you're saying you're retired, yeah, I thought I recognized you. Yeah, so yes, so if we haven't received any of that, then
You're not retired until EPM actually publishes that order that says you are placed in the retired reserves.
so if they're telling you retired, you need to make sure that they're producing your order or whatever, or make sure that your S1 is tracked and they can let us know. Because right now we're not tracking. Just to let you know. Okay. Yeah, so it's gonna go your 4187, it's all gonna go all the way to state, then they're gonna approve it, and then they're gonna put you on their tracker for when your retirement date is. Yes.
Right, so this, so I know the when we transition over to IPSA as of September, so this like closed out my AYE to make sense. It's close to that then, or?
Yes.
That's going to be normal for everybody, because what NGB wants to do is they want to show the day we converted from RPAM to IPSA.
Okay.
So everybody will show that date on their 5016.
Yeah, so those are only when you have like different types of breaks in your service is one it actually, but you're always gonna have that same AYE date.
So this wasn't changed.
Okay.
Changed because of like this.
Yes, it'll correct. Mhm.
Your new AYE date?
She's not gonna have, so she's saying that since it switched over, she thinks everything has to, it's gonna correct.
What does your AYE say right now?
Yeah. When you switch. Yes.
Yeah, you got to look at that, your AYE on the top. It says AYE, and what's that date say?
Right, it says current AYE on the slide. Can you go back to where it says, right? The
CRU AYE? That means your AYE is correct.
That's correct. Yeah.
Yes, yes.
Your different types.
It's just showing everybody's date is gonna cut off on the 19th. Because that's the day we converted from RPM to IPSA, and it's gonna be like that for everybody, but it doesn't change your AYE date. Yes, what you wanna look is, you wanna make sure that CURAYE is
That
your
one,
date.
That's the one that has to be correct. Okay.
Find one where it says the X is in the year limit.
Mhm.
But it's like 43 was less than 50. Why is it? Why do we have to see the year? I have a lot of them like that in the college where it's less than. I have a lot of X's.
And that's why we haven't gone over it, because some of them are reading excess and some of them aren't. It's a new system. So there's gonna be a whole bunch of, I've been asked that by everybody. Like, hey, what does this say? I'm like, you know what, to tell you the truth, it shouldn't be. Because he did not exceed. If you look at the egg,
A lot of points.
yeah, because you're allowed 130 points for IDTs. No one's gonna exceed that now. So, I mean, if you do, it's good for you.
There's an increase in these bits, there's an actually showing.
Yes.
Tracking a lot of points.
Yes.
For my final calculation.
Yeah. So, yeah, so everybody knows, and that's why I was saying in the beginning, we know there's issues and they are being addressed to NGB. So,
That's why. Okay.
yeah, there's a lot. That's just one of the many. So just to let you know.
Okay, another
Okay.
question? Another question?
Sure.
Says, I heard that active duty years count towards receiving retirement pay. Is that true? Active duty years count towards retirement pay.
Of course. It's
Yes.
points.
They better.
Yeah.
Let's see.
Yeah. If it didn't, I'd be complaining. What about the point? For your, okay, so thank you. So RPAM was a lot better, it had all everything like that. So your credible periods, it doesn't reflect on your DA 56. So what you need to do is, they're gonna be sending out stuff to your S1. We just got it, and it's gonna show you guys step by step how to check if your credible periods are reflecting. You have to go into IPSA, you're gonna have to review retirement points, the tile, go down, it's gonna open up, you're gonna look in your mode, you're gonna click on it, it's gonna open up again, and it's gonna say a Y or an N. If it says N, that means you're not being credited, and it would have to come to us. We're doing it again. Yes.
I have two questions. The first one is, in order to get like your retirement ID and everything like that, you have to wait for that order.
Yes.
That's the one that you take to the office to get.
Yeah.
So there's no like a 14.
No, you guys do get a DD 214. It's what is it?
It's called the DD 2014-1 now for M-Day soldiers.
Okay.
So what happens is, if you go through EPM OPM, they're supposed to issue your discharge order, and at the same time they're supposed to generate your DD 214-1. So if they don't do that, you need to submit a request to the respective offices, so that way they can generate that form for you.
So with this, with the DA 5060 not showing that much information. So when you go on into IPSA and you look at your retirement point, that first page has all your guys' information. It's gonna give obviously your unit, whatever. It's gonna tell you how many years you have, credible year, and then it's gonna have your REP date on there. So the NGB 23 used to have that for you guys. You said you can retire at this date. Well, this one doesn't have it. So you actually have to go in and say, look, and it'll give you your REP date. It'll say retirement eligibility pay date. Look at that date. That's when you're eligible to receive your pay. Just back it 9 months from there. That's when you call our office, and that's when we submit your packet. Okay. Yes.
The final question is, I know there's the periods, right? So let's say we're supposed to, start our retirement pay at age 60, but you're able to qualify for up to 2 periods, where it's like you get 58 to request.
Yes. So that would be 2 periods, would be 180 days.
So how do you find out what mobilizations or deployments that you've been on qualify for those periods?
So any deployments you guys go into Enduring Freedom or anything like that, those all count. They're 12302 and 12301. There are other ones that qualify as well that just got approved. It's the 12304 Bravo, and those were going to like Europe that Operation Adherence, whatever, Europe, those count now as well. All your Sec 4s, those count as well. Now, your Title 32 orders, those have to be emergency only, and it has to be approved by the President of the Secretary of Defense and Secretary of Defense. And then those are quote, it also comes out with an OSD memo, and that's how we know what's credible and what's not. If you want to know what's credible, if you guys want to look up the National Defense Authority Act 2008, 2015, that covers early need drop. That covers all your credible periods. What orders qualify? Please read the whole thing, because I do tend to give it to some of the officers and warrant officers, and they'll read the portions they want to read, and then tell me like, oh no, Mr. Lopez, you're wrong. I mean, what did you finish reading it? And then they'll be like, oh, that does count. I'm like, yes, that's why you don't get it. So just remember, it's called the National Authority Act of 2008, 2015, reduced age. Because if you put an NDA Act, there's a whole bunch of them. There's physical years, or National Defense Authority Act of 2008, 2015, reduced age. That covers all your regulations, your DODI, it's all in one. They put that DOD Act, they put it all together just for you guys. It covers the regulations, it covers everything.
So anything before 2008, after 2015.
Yeah, so 2008, remember, 2008, January 29th is when it started. It changed. And September 1st, 2014, that's when it was able to cross over fiscal years. So if you deployed in 2008, all the way before it crossed over, if you deployed in August, those 60 days would not transfer over to for your credible periods until 2014, September 1st. That's when it crossed over. So that means if you deployed in September, those 60 days would be pending until you went on another deployment, and it would give you another credible period. I am going to talk about CRCS and CRDP. It's always asked. So normally we talk about this when you're applying for your retirement pay. And I'll ask you, first thing I'm going to ask you, are you receiving VA? Everything, yeah, I got VA. What's your percentage? If they tell me 50% or more, then I'll let them know about your retirement disability pay. That means you are going to receive your retirement pay in full, and you're going to receive your VA compensation in full. If you are under that 50%, it's called a VA waiver. So if your retirement is $2,000 and your VA is $1,000, they're going to take $1,000 away from your retirement pay, and then you're going to collect your VA pay to $1,000. Still comes out to $2,000, but only $1,000 taxable because VA compensation is non-taxable. Okay. What was that? That's what it was approved. So yes. So retirement, for your NDA retirement, you are taxed. The first $20,000 for the next 3 years for everybody that retires is not taxable. So for your retirement pay, that's what California passed. So hopefully we'll be like the rest of the states and join them and be non-taxable for the retirement pay. Right now they're trying out this for the next 3 years. Your first $20,000 of the retirement is not taxable. So CRCS is that this combat special related compensation. If you are receiving CVRP, you cannot receive CRCS at the same time. If you are medically boarded, it's totally different. You can receive both until you reach the age of retirement. So you'll get, because you're not getting any retirement pay. So if they're PDRL, and unless they have PDRL in the 90%, most of the time they'll take their PDRL and get their VA, and it's just an offset until they're eligible to receive their retirement pay. Just remember with the CRCS, you have to apply for it yourself. It's not like CDRP, that's automatic. So once you come to see us and you're service connected, you're 100%, 50% or higher, whatever it is, when we submit it, we need your effective date and how much you're receiving. So when it goes to HRC and they send it to DFAS, they know to make sure that you get concurrent retirement disability pay. If you don't fill that in, it could possibly hold with your packet. Then you have to explain and then try to get that information for you. But it's a mandatory information that we need to submit for your retirement pay. Yes.
What's that?
Which one? CRCS or CRDP? CRDP is concurrent retirement disability. And then CRCS is, yeah, 50% or above, you guys will be able to collect your retirement and your VA at the same time.
Plus the disability pay.
That is your disability. So concurrent retirement disability pay. So it changes. So when you guys go file and you're in the gray area and you're getting VA compensation. So, because everybody can get that. It only changes to CDRP is if you're eligible to receive retirement. That's when you're going to get both. And CRCS is filed through DFAS. You just go on the website, in the little search engine box, you can put CRCS, click on it, it'll take you to the first link, and then that'll tell you how to apply for your CRCS. So just remember, if you are receiving retirement, you're not going to get both. You can only receive one because they're both disabilities. So what I always tell the service members, pick the higher one. If you're 100% VA, take that one. CRCS does have some other benefits for it, but it's up to you. It's always best to talk to DFAS too when you're trying to file for CRCS. Any other questions? Anything I can answer, anybody? So, I have nothing else. Thank you guys for coming. Please drive home safe. If you're ITA, if you have spouses, you guys are over 50 miles, I know we have the funding, but it just hasn't hit us yet. So what I'm going to be doing is I'm going to be sending you guys an email. I'm going to create your DTS. If you have lodging receipts or whatever, anything like that, when I start creating your DTS, I have all your emails. I will email you all your IDT people or ITA people. I will email you and ask you, can you please provide these documents? Once we get the funding, I want to go ahead and get that your guys' pay. So it's anybody 50 miles or more with a spouse. And you have to have a GTC. If you don't, we don't follow. Okay.
Do we have to put it on our GTC or?
Yeah, so if you didn't, since it was last minute and you guys didn't, it's okay.
Looks like I only made the correction
I'll just
in mine.
need those itemized receipts. Okay.
It's just hotel and.
Hotel and mileage. So you're authorized. So if you're over 50 miles, obviously it all varies on how far you are, but you're authorized lodging, per diem per day, and miles. So just if you're 50 miles, it's common sense. You're not going to get lodging. You're just going to get the mileage and the per diem for the day, and that is it.
That is zip code to zip code.
Yes.
So not
and
doorstep to
and
doorstep.
When we use, I know you guys probably use Google, but what we have to use is DTS. We go in there and we use that calculator, and then that'll give us your guys a number. Everybody good? Again, like I said, thank you for coming.
Thank you.
I highly suggest, since the government shut down, to over and hopefully shut down again, but to go to the next retirement start when they have all the vendors. Unfortunately, I won't be there. So, but you guys will be left in good hands with staff. We have a great team. It is Sergeant Agawa is one of our team members, along with Mr. Albert Spencer. Obviously, Chief is our deputy OIC, and then our NCOIC is Sergeant Fast Gonzalez. We're always busy, but if you guys give us a call, leave us an email, we will respond to you. Just give us some time and just work with us as we're going through these heartaches with the change of systems. But if you guys ever have any questions, especially now, you guys give us a call and we'll be happy to answer any of your questions.
SUTA forms.
Oh, yes, SUTA forms. They all need to be turned. Does everybody have their SUTA forms?
Mine was submitted directly to my reader.
Okay. So if it needs to be signed, usually we sign them. So if you don't have it with you, go ahead, take a picture of our email and shoot that SUTA request form over to us, just because we're usually the ones that have to
If we have to
verify that we're
we
here.
verified you guys did the duty. Trust me, there's always a reason why we have to do something, okay? So obviously, we've not done it before, and people didn't come and got paid.
How was SUTA requested? I sent
It's not signed by the mayor.
Okay, let them sign it. Once it's signed and they're completed, get it to us so we can figure it out. Okay? So if your guys' student form, if they have not been signed by your commander, don't send it over to us without a signature from the commander. So send it over, once you have the commander's signature and everything like that, we'll sign that you completed the duty, and then you can get the points, okay? Anything else? Yes.
All right, thank you very much, everybody.
For any surveys up at the front, Sergeant Ogawa and Mr. Spencer can take it.
Yes, ma'am.
Thank you.
Sir, do you have any questions later on?
No, I mean, getting ready here at, it's been working.
Yeah, yeah, we'll definitely work that right here.
I ordered getting everything down to getting it going.
Okay, yeah, and that's the biggest part, is going there. All right, so, do you have any questions for us?
Yeah, I mean, for them, all of our.
So we don't have to do the APR. APR place does it. They were supposed to have one next week, but furlough. But I don't know. Can I reach out to one? And I know some of the information applies to us.
No, you can turn it on.
So.
Let
Let me give you the AGR branch's email, because they will be the one to schedule all that.
Turning in your.
And they typically do it during the week. They don't do it during the week.
And they'll get your retirement. They make an appointment, and figure out. Okay. What about?
And do they do that here? Or is it in different places?
There's in different places.
So they'll do one here. The one that they were supposed to do, I think was here, and then they do one in Los Alamos.
Yeah, no, I'm sorry. I already know who he is. You're welcome. Be good.
So is this stuff that I need? I know you said you're working on this thing for the plug anybody.
Yeah, so your BSAD, are you on it?
So you're saying.
They don't show.
So they don't show, so like, they don't have to.
Yeah, so, and those are all. And you get 3 used to show.
Right.
Always.
So
So
that-
now it's saying that since you're not on that.
Okay, so but I do obviously need to get the.
Yes.
And then, we're saying the school committee was past a certain date.
Yeah, well, we can't manually do it.
And curious for the school to answer those just per day, right?
So it's for every 3 hours is what. For every 3 credit hours. Okay, so those are online work.
No, that one there was, Fort Lewis, that was, WMC at Fort Lewis.
Yeah, so you did something at Fort Lewis.
Yeah, it was like a month. worth.
Yeah, so you did something at Fort Lewis and you logged into a computer, they probably had to do a course or something. And they gave you points. So correspondence courses are only.
Yeah, it wasn't correspondence course.
That's not, but when you do NCOSs, there's some things that you do in there when they send you to distance learning.
Oh, yeah, maybe, that was way before.
Yeah, exactly. Sure, I have some too that are like, oh wait, when I went.
You jumped down, so I'm not standing up yet.
Like, points by SLC, SLC. It's just, he's saying you put hours or something.
Yeah.
So like, yeah. You tell my son,
I go to
make
changes to.
Yeah, and then.
Depending on the original election.
This is just.
So you've already hit 20 of your annual.
Yeah.
Did you ever respond to it or probably when you met Biden?
I don't remember.
Okay, so take a look in your items. If there's nothing, you're in option C. You are stuck. The only 2 ways to, when you come to apply for retirement, I will, or whoever is counseling you will go.
Yeah.
It's literally when you stop that.
So, but
It's all professional law, so there's no one to, you'll see, But yeah, we can get you explained because it won't be relevant to the very specific information.
She's gonna hit us.
But yeah, just verify that there's no 56.
Yeah, I will go over it. I would say
In your iPhone.
go over it.
There's no drop.
In your-
Oh.
So you have, so, you know, other than
This contact.
the,
Because obviously.
so she's the.
Yeah, 100%. Yeah.
Yeah, she's the.
Your office, like, if I'm updating my information, they like have updated point of contact for like.
So HRC. will-
AY, that's
point of
just the
contact
month and the day.
Mhm. So that's January 1st.
So you
So,
also pay your HRC and they'll give you.
It should be- so no break in service, so it should be the day before this date, which is correct.
Yeah.
Okay.
So the day before you actually enter the new service.
Okay. And then,
We're finding new things.
That's what I figured.
Yeah.
Yeah, so this is supposed to be.
I mean, if I early retire, I think I have like 18 minutes, but.
Yeah, it's still a way.
Other than that, it's still like,
Everything will change. You
I
have to
guarantee you,
drive
if I go
that
into your
usually
thing,
Run into,
and I
go
look
to
at
the
your
appointment, someone saying,
phone,
no, I'm 65, I'm 5 years old
2008.
today, I forgot.
But you're.
And then, yeah, and then we can. Absolutely. I guess I can take that. I'm not sure if we've established a place yet.
No, we don't.
Okay.
Just throw these right here. So you're gonna do this, the last column, yeah, so you're gonna do, yeah. The 4222. Yep, divided by, and then it's gonna give you your percentage.
The unit,
For
yes, so
retirement.
wherever you drill,
So-
it's only relevant on a deed.
Yes, based on your I3.
Okay, so you take all of
Whatever
the
rank,
D2 14s, if you don't know what qualifies to your unit S1, and they will let you know what works or not. And then they send it up to me, and I make a correction, and you'll see in your state profile, the date go down for retirement. So no, you have to, so if you're still in, you have to go through years, because we provide service to all retirees and 11,000 service.
Yeah.
Cause as I'm like,
So-
paying attention to it now, most of the reason
Yeah,
it's saying it's not credit, it's
so-
just
Yeah, I know.
deducting what it's like the membership
Yeah, so-
plans.
She would get ITA.
All of your deeds report.
Because pretty much every one of these X's, they're
Qualify for-
deducting whatever's in this column.
And then I would calculate it out, and back, we'll have the date that I actually start getting. Yeah, because I can adjust.
Yeah, that is. You would have a lot of. Like I tell you, you're coming
Which
to
type of
multiple.
insurance?
Okay, so we might have to go
TRICARE,
back
okay,
and
so
look.
TRICARE or TRICARE retirees, that's actually recently priced. It'll be 60 no matter if we have a release, so that's just the line for that. It is completely different, you are exactly right, it doesn't make sense, but that is what it all.
I gotta look at this whole line here.
Or, so.
Does the difference
Right now, we
between
don't really
this one
have.
and that
Yeah,
one?
this would be the point.
It's those 3 points there.
So the reason why this 3 points didn't count is because
They have a
it looks like you were on
pay calculator.
IET.
And you can
which
tell
is,
that that's. supposed to
Initial
actually
entry.
one that-
Yeah, so we're just, you're on some type of active duty. So typically on active duty, your membership points doesn't count
On 19
because
October.
you're already on duty, you're on active.
When-
So that's why it didn't count this one. So let's see where I didn't.
We'll have the
count. So
read out.
what I'm doing is I'm looking at from this day to your
You
AYE.
don't have on the
So it's
30th.
counting it towards
And
what
that's
it
in
is.
and out as of October, which will be close to now, so it's kind of really close with that.
9, 10,
So
11,
you do
12, so
both
we
of
have
one
a
of-
good year here already. It's just taking this membership point off, which is your active, which is typical.
23.
This one right here,
Yeah, and it was on 19 October.
like here,
Well, I know the next group down, I can look just by the dates of the
Yeah.
state, I was on a mode.
yeah, so it looks like it just,
National mode.
so it looks like it just didn't count your daycare because you were on active.
Okay.
But if you get with.
So it's basically, if I'm on active duty, it's automatically gonna take those points.
Per regulation, yes, if you're on
Okay.
active duty orders, you don't get credit for your membership points.
Okay.
If you get it.
Some people are getting those membership points counted and it's not supposed to, so that's an error, but like if it doesn't count these membership points, just make sure that period you are on active duty. If you were and it wasn't counted, then
Okay.
that's an issue.
Is this
Yes,
supposed
so
to be
that's
like
right here. You're not gonna receive the pay until.
sheet 3, but
29.
is this just showing like those
However,
things?
it'll
It's not credited yet towards a good year?
So, this is now all encompassing. So usually on the 23-8, it will show you, it will list out every time you're on IDT, all the points you earned for that period. Obviously, this is not, it's not on IDT because you've done more than this many type of IDT, so we don't want to look at this.
Yes, yeah,
But
exactly.
on IDT, those don't count towards early eligibility retirement, right?
It's always active.
When you're on these modes,
But at least you get paid.
Well, but this is all within 2024.
Yeah, so it's not all encompassing. So when you're on mode, you want to make sure that says yes.
Right. I was just wondering what this particular one was because it was only in this time period, and it's really confusing too because it jumps around.
Yes.
Like,
Yeah, so this is, again, this is new form on a 23-8. It lists everything out.
Right.
It's supposed to do that, but it doesn't. And we know it's incorrect.
Got it.
So you could just, yeah, until we get NGB to fix that.
That part,
So look at my retirement points. Go to IPSA and find the retirement point tab to like.
Yeah, so you want to go to IPSA, into your IPSA, and it's going to say view retirement points. So it's
Okay.
going to look like this.
how long does it take to do all the things to retire? So that's gonna be on your availability in the unit, and if anyone wants to help with it. So that's outside of our realm, unfortunately. Only retirement pay is. Yeah, so I would do it sooner rather than later, obviously. Yeah.
So if
Call us. No, so 9 months before you try.
And then side quest note.
Yes.
If I had the correspond, if I had completed correspondence courses, but none of that information is tracked in the
Okay, go to.
would that be like that'll let the unit go in?
We can all have.
Yeah, you have to submit the documents to us and we'll take a look at it.
Okay.
Yeah.
We have records.
So you go in here into your My Soldier and then it should say,
Was not legally obligated to.
you can just type here.
That document says, no matter what, even if it's our error, you're gonna get paid in your.
Yeah. See, view retirement points. If you don't have the little tile and it's gonna look like this, you just put in your employee ID and then it'll just pop right up.
Got it.
It's gonna look. It's gonna look.
I can find it.
Yeah.
That gives me the information to find it. Yeah.
So-
Like I said, I was just trying to dial stuff, and then
So
for
it'll
the correspondence courses, is that like what I need?
No, not really.
certificates
Unfortunately,
that
yeah,
I
so that one's
got
all-
from them, or like what
and
would
it
I
goes
need
step
to
by
like
step, and
have
I
my
can
unit
see all the
or
steps
like
and all the
try to get that?
see all the steps.
Is it ATAR's course or just?
Probably not be able to see.
I think so. Or I know for a while there were other.
Yeah, I would say the certificates, and if it's ATAR course, your ATAR's transcript, and then we'll take a look at it. So it has to be before, I think you said,
Military.
Yeah, it was
and then they have a list of all the ATAR's.
April 2016.
Yeah, so they have a list of all the correspondence courses that are eligible for it, and you can go ahead and take a look.
And if I don't have it, I should be able to receive it.
Yeah, because I know
I think that would be a reasonable course of action.
I did some of them because there's one
So
that was like an
you would have to
80-hour course at the very least.
Did you
It's
take a
not
picture of
huge,
that
but
last
like
slide that
I think
we
I had done more than that. But
had?
that's just the
On
one I
that
remember
Guard website,
because
has
it
that
was
QR
a
code takes you
inter-service
IG, and it'll have
thing
this-
similar to like
that one for their program.
the NCOES type of
Okay.
things.
Yeah.
And I had done that back when I was on deployment, my last deployment in 2012. So
Okay, yeah, it's definitely send it over and we'll take a look. 'Cause some correspondences,
So yeah.
courses
for
don't
military
count, some
payment,
does, so
that
we
is
just have to go
a-
in and look at those,
Yeah, what you're asking.
and see if we can still input that. I know there was a time when
Oh,
they
that's
weren't allowed
also the-
us to input it, but I don't know if.
Yes, so.
Let us, but we'll definitely do the research.
yeah, when did I'll go back to reference my GST too, because I know that had a lot of stuff on there. So
Okay.
All right.
All right, you're welcome.
Then we would have to, so I registered you. No, because you talked to Sarno Gal on the phone the other day. I registered, you guys are registered.
Then we
Yeah.
okay.
Yes, yeah. No, that's okay. That's why we're here.
And then I was going to say.
Okay, that's fine. Go back, listen to it. I know it's a lot of information,
Yeah.
so hopefully you guys get good news. Yeah,
Bye-bye.
absolutely. Drive safe. Mr. Sproul is taking care of it.
You got it to work?
Yeah.
Oh, awesome.
Yeah, I can
Did it-
literally generate
Did
it
it
now.
send him?
It will, so it has a batching time. Yesterday, we created, for Sergeant Goling, Anna Goling's husband,